Good afternoon. Can I remind members of the COVID-related measures that are in place and that face coverings should be worn when moving around the Chamber and across the Holyrood campus? The first item of business this afternoon is time for reflection. Our time for reflection leader today is Lee McLemon, President of the Aberdeen Scotland Stake, the Church of Jesus Christ of Latter-day Saints.
Presiding Officer and members of the Scottish Parliament, thank you for the invitation to participate in today's proceedings. Abraham Lincoln taught that the strength of a nation lies in the homes of its people. Confucius also taught that the strength of a nation derives from the integrity of the home. In 1995, The Family, a proclamation to the world, was published by the Church of Jesus Christ of Latter-day Saints. Contained in that proclamation is a call to all officers of government everywhere to promote those measures designed to maintain and strengthen the family as the fundamental unit of society. The proclamation declares one eternal truth that I believe, if understood and applied, will bring peace to our families, our homes, communities and nation. It states, all human beings, male and female, are created in the image of God. Each is a beloved spirit, son and daughter of heavenly parents. And as such, each has a divine destiny and divine nature. Inherent in that truth, that we are sons and daughters unto God, lies the beauty that each of us are brothers and sisters. When we understand our true identity as sons and daughters of God and our relationship one to another as brothers and sisters, instinctively one another's welfare, care and concern becomes our own, because we are all family and our lives are a family matter. In the Book of Mormon, another testament of Jesus Christ, an ancient prophet historian called Nephi taught, I know that God loveth his children. The Bible also teaches that God so loved the world, his family, that he gave his only begotten Son. Of the many titles that God would reserve, he invites us as his children to call him Father. In the midst of our Saviour's atoning sacrifice, in the garden called Gethsemane, he addressed his Father and our Father in the intimacy of the Hebrew word Abba, which being interpreted is Papa or Daddy. My brothers and sisters of this chamber, may God bless you, may he bless our children, our families and our homes, and may he bless each one of us to see each other in our true identities, not only as children, sons and daughters of Scotland, but as sons and daughters of God and all members of his eternal family. In the name of Jesus Christ, amen.
Thank you. Thank you, Mr McLemon. The next item of business is consideration of Business Motion 2456 in the name of George Adam, on behalf of the Parliamentary Bureau setting out changes to today's business. Any member who wishes to speak against the motion should press their request to speak button now. I call on George Adam to move the motion.
Thank you, Presiding Officer, and moved.
No members asked to speak against the motion. Therefore, the question is that motion 2456 be agreed. Are we all agreed? The motion is therefore agreed. The next item of business is topical questions. In order to get in as many people as possible, I would prefer short and succinct questions and responses. And I call it question number 1, Jamie Green.
Thank you, Presiding Officer. To ask the Scottish Government what resilience measures are in place to tackle serious organised crime and terrorism in light of reports that the Assistant Chief Constable in charge has been suspended.
Cabinet Secretary Keith Brown.
This is an operational matter for Police Scotland. The Chief Constable has confirmed that Assistant Chief Constable Tim Mayers will move from his current role on an interim basis to take responsibility for the organised crime, counter-terrorism and intelligence portfolio. The member will appreciate that it would not be appropriate for me to comment further while an investigation is underway.
Jamie Green.
I do appreciate there's an investigation underway. However, it is the seniority of the individual and indeed the importance of his remit which causes the most concern. The Assistant Chief Constable suspended leads the charge in tackling serious organised crime, terrorism and cybercrime in Scotland. We know that cybercrime increased 95% last year. Web-based grooming offences have increased by 80% over 5 years, and the police are currently investigating nearly 2,500 serious organised gang members in Scotland. So, can I ask if the Cabinet Secretary is confident that we are making progress in tackling these crimes, and what steps has he personally taken in the past few days to make sure that these recent events will in no way impact Police Scotland's ability to protect the public?
Cabinet Secretary.
Well, as I say, President Officer, there's not much I can say in terms of the actual investigation. And just as the member says, it's very important because of the level of the person involved in terms of the organisation. It would be just as important for a member at any level in the organisation this kind of case. And it is the responsibility of the Chief Constable to deploy his force as he sees fit. I have had discussions in the last few days both with the police themselves and with the SPA, and I am confident that the police and the Chief Constable will ensure that the same kind of coverage, the same kind of effort has been made in relation to organised crime, cybercrime, as was being made before this case came to fruition, and that will be affected by the changes which the Chief Constable has put in place.
Jamie Green.
I'm reassured in a sense that a conversation has taken place about the resilience of the police's ability to handle such serious crime in Scotland, but let's not forget, Presiding Officer, it's been over a year since Dame Angelini's final report into police misconduct and complaints handling was published. The Government, I remember, snuck out a progress report on the final day before summer recess. I raised it as an issue at the time, but we've heard nothing since. It remains a fact that, astonishingly, an officer can resign while suspended during an investigation with no further action or recourse taken whatsoever. Why is this still the case?
Cabinet Secretary.
Well, that's a very important point that Jamie Green makes. He knows it was one of the recommendations in Dame Eilish Angelini's reports. He'll know there were over 100 such recommendations, many of which have been progressed. And just to reassure the member, a meeting took place last week at which the latest tranche of recommendations which have been progressed were summarised, and will shortly make a statement, make public the progress that's been made throughout the range of recommendations. The one that the member refers to, of course, is one that would require primary legislation to change. And it is a question that we will have to take forward that, and perhaps another provision which is in relation to advisory and barred lists, whereby somebody convicted of offence in one police force can't join another police force without that police force being told about it. So those are on their own two very important recommendations, but they will require primary legislation, and if we take them forward will require to be fitted into the legislative programme. Just to say that Justice currently has around 22 bills scheduled for this Parliament alone before any bills which the member might bring forward and others. So it is a congested programme, but we do intend to take that forward seriously, and serious progress has been made throughout the recommendations that Eilish Angelini has made.
Pauline McNeill.
Thank you. Can I thank the Cabinet Secretary for that information? Cabinet Secretary will be aware that there has been an 18-fold increase in stoppages of so-called street value in the space of a year, while seizures of psychoactive substances nearly doubled. I would just like a further assurance that the Cabinet Secretary will be mindful that this successful work does continue and is not compromised in any way.
Cabinet Secretary.
I would want to give the member that reassurance, and the reassurance is based on the 17,000 police officers which we have in place, and also the work that's been done through some new initiatives. Psychoactive drugs were mentioned by the members, and she'll be aware of some of the things which have been done in relation to the presence of those drugs in prisons. But she'll also be aware of recent changes by the Lord Advocate in relation to how these drug offences are prosecuted and dealt with by the police. So yes, there is a real focus on this, and of course it should not be the case necessarily that the discovery of an increased amount of drugs is necessarily seen as increased prevalence. It may well be due, and I'm not saying it is, we can't properly determine exactly what it's due to, but it may well be down to the fact that the police are acting very effectively to locate and seize these drugs as well.
Audrey Nicholl.
Thank you, Presiding Officer. To ask the Scottish Government what it's doing to strengthen the process for the handling of complaints and misconduct allegations against police officers.
Cabinet Secretary.
Can I thank the member for the question? See, I've partly answered it, I think, in response to Jamie Green's supplementary question, but following the review which is mentioned, it was mentioned before by Dame Eilish Angelini, which was into complaints handling, investigations and misconduct issues, a number of recommendations have already been implemented. Others, as I've said, will require legislation and will consult on those proposals further to further strengthen the framework for complaints and misconduct allegations against police officers, and we'll do that next year, including the conduct framework for senior officers. There is, though, currently an established process for the handling of police complaints, investigations of serious incidents and misconduct, and I welcome the significant progress which has been made by, amongst others, the Police Scotland, the SPA, the Police Investigations and Review Commissioner, the Crown Office and the Procurator Fiscal Service to drive improvements in systems and processes in advance of those legislative changes which I mentioned earlier.
Question number 2, Daniel Johnson.
To ask the Scottish Government what support it is providing NHS Lothian and other NHS boards, given the consequences and impact of delayed discharges.
Cabinet Secretary Humza Yousaf.
I can thank the member for a very important question. The health and care system is under extreme pressure due to the pandemic, and all health boards are experiencing significant issues, including workforce challenges and high levels of delayed discharge. To help alleviate some of that pressure, we announced a substantial new package of over £300 million in hospital and community care to support NHS and social care systems over this winter. A substantial proportion of that funding going directly into social care to help with delayed discharge. I also announced last month further funding of £10 million to support health boards maintain resilience throughout winter by putting in place a range of measures, including appropriate levels of staffing at the right place at the right time. I've been meeting with the Chief Executive of NHS Lothian alongside the Chief Executive of the City of Edinburgh Council and Judith Proctor and the team at the Edinburgh Health and Social Care Partnership as well on a weekly basis for the last month to discuss this very issue.
Daniel Johnson.
I thank the Cabinet Secretary for that answer, and I'll be very measured in my question because myself and others in the Chamber today were at a briefing on Friday which painted an alarming picture where there has clearly been a spike in delayed discharge, particularly in Edinburgh, leading to a logjam right the way through inpatient care and into accident emergency. So can I ask the Cabinet Secretary, have in his meetings they identified what the issue is? Because my understanding is it's not necessarily just one of money. Is this about social care provision or are there other blockages to discharge? And is this an issue that's happening elsewhere in the country?
Cabinet Secretary.
I can thank Daniel Johnson, and of course if he wants further briefing than this topical question necessarily will allow, then I'm happy to speak to him offline with my officials in detail. In terms of the questions he asks, there are some Edinburgh-specific issues. That's why I meet with Edinburgh every single week, because I'm really concerned about the level of delayed discharge, the highest in the country, but also the very unique circumstances. So, for example, there is a severe lack of in-house provision, as he probably knows, not just in care homes, but of course care at home, which is a vital part of keeping people out of hospital, be it via out of the back door or indeed preventing them coming through the front door. Workforce is clearly a challenge as well in Edinburgh, given that there are other competing workforce pressures in hospitality and so on and so forth. But he is absolutely right that finances, I have said to Edinburgh City Council, to the Health and Social Care Partnership and to Lothian Health Board, should not be an issue. In fact, I agreed additional funding, recognising that, for example, for interim care placements in Edinburgh, the cost may well be higher in Edinburgh than it would be in other parts of the country. So I'm convinced and content that funding isn't the issue as he articulates, but there are a significant number of other issues that we're trying to work through with Edinburgh. And given the time that I have here in topicals, I'm happy to either write to the member, or if he wants a meeting, I'm more than happy to discuss these in greater detail.
Daniel Johnson.
Indeed, I would welcome more detail and a meeting. Of particular concern is inpatient care, and particularly within trauma. One particular example is the orthopaedics, where delays in treatment can obviously have consequences in terms of bone growth and so on. Is there a particular concern in particular areas of inpatient care, and would you be able to elaborate that and what action is being taken to remove those issues?
Cabinet Secretary.
Yes, we have concerns right across the board, but he's absolutely right to focus on the areas that he does. What I would say is really important is we can often spend a lot of time in this chamber, understandably so, focused on unscheduled care, the emergency care, but actually elective care. We know there has been a building backlog due and exacerbated certainly by the significant impact of the pandemic. And what we're doing is trying to use all the resources possible nationally. So taking, for example, the likes of the Golden Jubilee, how can can the Golden Jubilee help with orthopaedic surgery, be it in Lothian, be it in the West Coast, or indeed any other part of the country. So we're trying to maximise as much resources as we can to help with the elective backlog, because we know the longer people have to wait for that surgery, it builds up problems for us in the future. But again, I'm more than happy to go into more details with Daniel Johnson at a meeting.
Sandesh Gulhani.
Thank you, Cabinet Secretary. You have announced money for delayed discharges and agreed in your previous answer that money doesn't necessarily seem to be the problem. So my question is, when do you expect to help more long-suffering patients receive the care they need and deserve by reducing the current level of hospital delayed discharges?
Cabinet Secretary.
So it's reducing. In the last week's figures, we have gone below 1,500. Still far too high. And I want it to reduce even more. So I'm happy to provide Sandesh Gulhani with the latest figures, but I would say that we are beginning to see small levels of reduction, but I need that to be far bigger than it is. So I'm meeting with the health boards, the 6 health boards that have the largest number of delayed discharges, and we're working through solutions. And we're making some progress, as I say, but I would hope that progress continues. And as I have said to Daniel Johnson, and I've made it clear to the health boards, that funding and finances shouldn't be the barrier to helping to reduce those delayed discharges.
Christine Graham.
Thank you, Presiding Officer. I also attended the briefings on Friday with NHS Lothian, and then I went on to one with NHS Borders. So further to the answers to Daniel Johnson, it's not just an Edinburgh problem. Figures for beds as of today at the Borders General Hospital are out of 300 beds, 7 are occupied by COVID patients, but 51 by those whose discharge is delayed. Now, while appreciating the various causes of this, losing 17% of bed capacity with all the predictable challenges this winter lie ahead, we have an immediate problem. Can I ask, and listen carefully to the Cabinet Secretary's answer, if he's also meeting with Rafe Roberts of NHS Borders, because it's also a problem in the borders?
Cabinet Secretary.
Yes, you can imagine I discuss this issue with every single health board. Of course, Christine Graham is absolutely right. It's a problem that every health board contends with. There's also areas of very, very good practice, which I'm ensuring is shared right across every single health board. But Christine Graham, as always, gets to the crux of the issue here, which is, of course, if we invest not just in care home placements, which are hugely important, but care at home and making sure people have the appropriate packages at home, we hopefully prevent them coming through the front door of the hospital too. So yes, to give her an assurance, I meet with the chief execs, the chairs, every single week. Of course, Rafe Roberts is on those calls, and we discuss these matters in great detail.
Martin Whitfield.
I'm very grateful, Presiding Officer, and I'm very grateful for the answers that we've heard today. Following the meeting on Friday, can the Cabinet Secretary say where the staff are going to come from that are needed to alleviate this problem across Scotland?
Cabinet Secretary.
So recruitment is underway, is going well. Job adverts are not just out, but interviews are commencing, and a number of people have already been recruited. I did reference in my my answer to Daniel Johnson, that Edinburgh does have an acute problem, because there's a number of other pressures that are upon them from the retail sector, from hospitality, and so on and so forth. But some of the £300 million of funding that I announced, of course, a bulk of that, a significant proportion of that, was for additional recruitment of Band 2s to force. So that work is very well underway, and I'm happy if the member wishes to write to me if he wants more specific detail on recruitment. I'm happy to provide the numbers too.
Stephen Kerr.
Thank you, Presiding Officer. Can I ask the Cabinet Secretary if you will tell us how many people are now waiting in Scotland for the hospital appointment, given the comments he's made in relation to capacity within the system?
Cabinet Secretary.
Forgive me, I don't have the figures to hand in terms of exactly how many are waiting for a hospital appointment, but happy to look to see if we have those figures and provide them to Stephen Kerr. What I would say is we're investing heavily to try to free up as much capacity as we possibly can, delayed discharge, and freeing up getting those delayed discharges back out, and those people back out into community is going to help us to free up space within the hospital, see more people, which is important. But also, of course, our investment in primary care is really, really important for that, because we don't want everybody to just have to go into hospital to be seen. Where they can be seen in the community, where they can be seen at primary care, is why we're making investment right across the entire system. But for the exact figures that Mr Kerr is looking for, I'm more than happy to see if they can be provided to him.
Thank you. That concludes topical questions. The next item of business is a statement by Nicola Sturgeon on COVID-19 update. The First Minister will take questions at the end of her statement, and so there should be no interruptions or interventions. I call on Nicola Sturgeon. First Minister.
Thanks, Presiding Officer. I'll give an update today on the general COVID situation, but I'll also share the most up-to-date information we have on the Omicron variant, both its transmission here in Scotland and the world's developing understanding of it. And I'll set out the steps we must take to slow its spread and to stem transmission of the virus more generally. Firstly, though, today's statistics: 3,060 positive cases were reported yesterday, 9.2% of all tests carried out. 576 people are currently in hospital with COVID, which is 15 fewer than yesterday, and 38 people are in intensive care, which is 5 fewer than yesterday. Sadly, a further 12 deaths have been reported over the past 24 hours, and that takes the total number of deaths registered under the daily definition of deaths to 9,661. And I want once again to send my condolences to everyone who has lost a loved one. I'm pleased to report, however, that the vaccination programme continues apace. 4,355,063 people have now had a first dose. 3,962,203 have had 2 doses, and 1,922,604 have had a booster or a third dose of vaccine. On first, second, third and booster doses, Scotland is still the most vaccinated part of the UK. Indeed, at this stage on booster doses, we are comfortably ahead of the other UK nations, with around 40% of the over 12 population having had a booster jab to date. So I want to again record my thanks to everyone involved in organising and delivering the vaccine programme. Today's weekly update coincides with the latest 3-week review point for all of the remaining COVID regulations. I can therefore confirm that at our meeting this morning, the Cabinet agreed to keep all of the current protections in place with no immediate changes. Given the very significant risks posed by Omicron and the continuing high and indeed once again rising number of cases in Scotland overall, our judgment is that it would be inappropriate to lift any of the protections currently in place at this time. On the contrary, we agreed that it's vital at this stage to strengthen compliance with all of these existing protections. We also agreed that, in light of the rapidly developing Omicron situation, it was important to keep the need for any additional protections under daily review at this stage, and the importance of doing that will be clear from the latest data, particularly the data I will share shortly on Omicron. Firstly, though, let me quickly summarise the overall situation. After 2 weeks of falling case numbers, the last 7 days have seen a rise in the overall number of cases. Last week I reported that the number of new cases being recorded each day had fallen by 14% over the preceding 7 days. However, in this past week, cases have increased by 11%, and we're currently recording just over 2,800 new cases a day on average. Encouragingly, though, cases in the over 60 age groups have continued to fall in the past week by a further 8%. And there's little doubt, if any doubt, that this reflects the effectiveness of booster vaccines. However, in all age cohorts under 60, cases are rising again. In total, cases amongst under 60s increased by 13% in the past week, and since people under 60 currently account for more than 90% of all cases, that has inevitably driven an increase in the total number of cases recorded. More positively, the number of people in hospital with COVID has fallen further in the past week, from 706 to 576, and so has the number in intensive care, from 54 to 38. That is, of course, welcome news, but we shouldn't in any way be complacent about that. Firstly, because we know there is always a time lag between rising cases and rising admissions to hospital. And secondly, because the NHS continues to be under very severe pressure from direct COVID pressure, but also from the backlog of work created during the pandemic. On top of all of that, the NHS may soon face additional pressures, for example from flu, as we head further into winter. And there has always been the potential for COVID cases to rise during December, as may now be happening as a result of more people mixing indoors more often. So in any circumstances, we would be concerned about the current high level of cases and the impact this might have on the NHS. But the emergence of the Omicron variant is now an additional and indeed a very significant cause for concern. Public Health Scotland's weekly COVID report will from tomorrow provide more detail on both confirmed and probable Omicron cases in Scotland. It will include data not just on confirmed cases but also on the number of PCR tests showing what is called the S-gene dropout. That is not conclusive evidence that a case is of the Omicron variant, but it is highly indicative of it. The report will also contain data on the age, sex and health board area of Omicron cases. In weeks to come, and as soon as the quality of data allows, these reports will also provide detail on the vaccination status of and hospital admissions and deaths associated with Omicron cases. For now, though, let me summarise what we currently know about the presence and spread of this new variant in Scotland. I can confirm that as of 5 p.m. yesterday, there were 99 confirmed cases here. This is an increase of 28 since yesterday. And to give a sense of the speed of increase, albeit at this stage from a low level, the figure I reported this time last week was 9. So we've seen more than a tenfold increase in the space of a single week. A still low at around 4%, but nevertheless steadily rising proportion of cases also now show this S-gene dropout that, as I said a moment ago, is highly indicative of the Omicron variant. Our estimate at this stage is that the doubling time for Omicron cases may be as short as 2 to 3 days, and that the R number associated with the new variant may be well over 2. I can also report that there are now confirmed cases in 9 of our 14 health board areas, suggesting that community transmission is becoming more widespread and possibly more sustained across the country. Now, our health protection teams are working hard through contact tracing, testing and isolation to slow the spread of Omicron cases. That work will obviously continue, and I want to thank them for their excellent efforts. However, given the nature of transmission, I would expect to see a continued and potentially rapid rise in cases in the days ahead, and for Omicron to account for a rising share of overall cases. And all of this explains, I hope, the requirement for government to review the situation on a daily rather than a weekly basis at this stage. Let me turn now briefly to the developing global understanding of this new variant. And the first point to make is that there is still a great deal we do not yet know. However, data on cases worldwide, including here at home, gives a reasonable degree of certainty at this stage that Omicron is more transmissible than the Delta variant, and perhaps significantly so. Early, though again unconfirmed data, also suggests that Omicron is more capable of reinfecting people who have had the virus previously. In other words, it has some ability to evade natural immunity. And of course, there is also a concern that it may evade, to some extent, the immunity conferred by vaccination. Let me stress again, though, at this point, that even if that latter point does prove to be the case, getting vaccinated will still be vitally important. Vaccines being slightly less effective is not the same, nowhere near it in fact, as vaccines being ineffective. Being vaccinated will still give us much more protection against Omicron, especially from severe illness, than we will have if we are not vaccinated. Now, further data and analysis is needed to confirm all of the hypotheses about the transmissibility, immunity, evasion and severity of Omicron. We will learn more about its characteristics and implications in the days and weeks ahead, and this developing understanding will inform and shape our response. However, we can assume already that the emergence of Omicron is a significant challenge for all of us. A variant that is more transmissible than Delta and which has even a limited ability to evade natural or vaccine immunity has the potential to put very intense additional pressure on the National Health Service. And a key point we must understand is this, and I want to underline this point. The sheer weight of numbers of people who could be infected as a result of increased transmissibility and some immune evasion will create this pressure even if the disease the new variant causes in individuals is no more severe than Delta. So there is no doubt, unfortunately, that this is another serious moment in the course of the pandemic, and I will talk shortly about what that means for all of us. But firstly, let me outline the principles that will guide any decisions government may have to take in the days and weeks ahead.
It is worth noting that the period ahead, as we learn more about the new variant, may involve very difficult judgments for governments everywhere. Indeed, many governments around the world are already taking decisions that we all hoped were behind all of us for good. For the Scottish Government, our first principle will be to seek to do what is necessary to keep the country as safe as possible, even if that is sometimes at the expense of being popular. And second, we will strive to get the right balance between acting proportionately and acting preventatively. We know from experience, sometimes bitter experience, that with an infectious virus, acting quickly can be vital. If we wait too long for data to confirm we have a problem, it might already be too late to prevent the problem. In fact, acting preventatively is often the best way of ensuring that action can remain limited and proportionate. However, after 2 years of restrictions, with the accumulation of social and economic harms that previous restrictions have caused, we also know that it is ever more important to minimise further restrictions as far as is possible. So while recognising that it is never a perfect science, we will seek to get that balance right. Let me turn to the action we have taken so far and what we are asking everyone to do now. Firstly, in line with the other UK nations, we have tightened travel rules. In the past week, Nigeria has been added to the travel red list. That means anyone arriving in the UK from Nigeria or the 10 countries already on that list must enter managed quarantine for 10 days. In addition, since this morning, anyone aged 12 or over who is travelling to the UK from outside the common travel area will be required to take a COVID test shortly before they leave for the UK. And this is in addition to the requirement to take a test on day 2 after arrival in the UK and to self-isolate pending the result. My advice to anyone planning travel between Scotland and countries outside the common travel area is to check on the Scottish Government website for detailed guidance and to also check the requirements of the country you are travelling to, because the requirements there may well be different to those in force here. Presiding Officer, at this stage, travel restrictions do have an important part to play in responding to this new variant. However, given that we already have some community transmission in Scotland, what we do domestically is also important. That is why Cabinet decided this morning to keep in force all of the existing protections. However, we also agreed that it is vital not just to maintain, but to strengthen compliance with these protections. It is time for all of us to go back to basics and ensure that we are taking all of the steps required to minimise the risk of getting or spreading this virus. Indeed, it is through heightened compliance with current protections that we will give ourselves the best possible chance of avoiding the need for any additional protections. So I'm asking everyone to make an extra effort to do so from now through the festive period and into January. Obviously, that means wearing face coverings in indoor public places, ventilating rooms by opening windows whenever possible, and ensuring good hand and surface hygiene. However, there are 2 important protections that I want to emphasise particularly strongly today. Firstly, working from home. We already advise people to work from home wherever practical. Today, I am asking employers to ensure that this is happening. To be blunt, if you had staff working from home at the start of the pandemic, please now enable them to do so again. We are asking you to do this from now until the middle of January, when we will review this advice again. I know how difficult this is, but I cannot stress enough how much difference we think this could make in helping stem transmission and avoiding the need for even more onerous measures. Second, testing and isolation. Test and Protect is deploying enhanced contact tracing for all cases with the S gene dropout that is indicative of Omicron. For these cases, household contacts of close contacts, rather than just the close contacts themselves, are being asked to test and isolate. If you are asked to do this, please comply. More generally, though, for non-Omicron cases, if you have symptoms of COVID, please get a PCR test and self-isolate until you get the result. If your result is negative, you can end isolation at that point if you are double vaccinated. If positive, you must isolate for the full 10 days. And crucially, please remember that you can have this virus even if you have no symptoms. So testing regularly and repeatedly with lateral flow devices is essential. We are asking everyone to do a lateral flow test before mixing with people from other households and on every occasion that you intend doing so. That means before going to a pub, to a restaurant, visiting someone else's house or even going shopping. Let me be clear, Presiding Officer, I am not excluding myself from this. I am currently doing a test every morning before coming to work. I will do a test on any occasion I mix with others over the festive period, and I will ask anyone visiting my home over Christmas to do likewise, and I'm asking every member of this Parliament to lead by example and to do that too. LFD kits are easy to get through NHS Inform or from local pharmacies or test centres, and they are very easy to use. So please, please do this. It will significantly help us break the chains of transmission. If we do all of these things, difficult though I appreciate they are, then even with a more transmissible variant, I do really hope we can avoid the need for any further measures. I cannot guarantee this, however. I don't think any responsible person in my position could ever guarantee this at this stage. And given the situation we face, it is important to remain open to any proportionate measures, for example, the extension of COVID certification, that might help us reduce the risks should the situation deteriorate. The Government will carefully analyse the data in the days ahead. I hope this doesn't require us to take any decisions ahead of my next scheduled statement a week today, but if it does, I will obviously return to Parliament. I want to end, Presiding Officer, by again reiterating the vital importance of vaccination. We are currently the most vaccinated part of the UK. We have more quickly than other nations implemented the JCVI advice to reduce the gap between second doses and boosters, but we are not complacent. We are identifying and training additional vaccinators. So far, we've added the equivalent of more than 300 additional full-time staff to the vaccination workforce. We are also working to further increase vaccination capacity. A number of health boards, Fife and Tayside for example, are now using drop-in centres to make vaccination even easier. And we are in the process of increasing the use of mobile vaccination units provided by the Scottish Ambulance Service. In addition to these efforts, which are intended to improve the supply and availability of vaccination, we are also working to increase demand by encouraging even more people to take up the offer of vaccine. In the past week, therefore, text or email messages have been sent to those aged between 40 and 60, encouraging them to book their booster jab. For those now able to get a booster jab, that's anyone over 40 who had the second jab 12 or more weeks ago, please arrange an appointment as quickly as possible. You can book through NHS Inform or by calling the vaccination helpline. And if you're 16 or 17, you can, of course, also and should also book your second dose in the same way. Last week, we also sent blue envelope letters to all 50 to 59-year-olds who have not yet been vaccinated at all. And a similar letter has been issued over the course of this week to everyone between 40 and 49 who hasn't yet been vaccinated. Take-up of the vaccine has been exceptional, but there are still a significant number of people in those age groups who haven't been vaccinated. So to anyone in that position, let me be clear about this. It is not too late to get vaccinated. In fact, it is now more important than ever to get your first jab and start to get that essential protection. To conclude, Presiding Officer, Omicron is a really concerning development and the most unwelcome of developments at this stage in the pandemic. But, and this is the more positive aspect, the actions that have helped us against other variants will also help against Omicron. That means we all know what we need to do in the days and weeks ahead, and so my request to everyone is to follow these steps. Please go back to basics and make sure that we are all doing everything that we are being asked to. That's the best way we have of making Christmas and the New Year as safe as possible and of maximising our ability to navigate this next unwelcome but unavoidable challenge without any additional protections being necessary. It will also help us protect the NHS and those who are working so hard in the NHS and social care to keep us all safe. So please do get vaccinated. Secondly, do test regularly on any occasion before socialising or mixing with people from other households. And finally, make sure you comply with all of the existing protections. Wear your face coverings on public transport, in shops and when moving about in hospitality. Keep windows open not easy, I know, in the weather we're currently experiencing, but try to keep windows open if you're meeting people indoors and follow all of the hygiene advice. And if you were working from home at the start of the pandemic, please do so again for the next few weeks. None of this is what any of us want 2 years into this ordeal. I know that, but it is the best way of slowing the spread of the virus in general and Omicron in particular. And by doing that, we do give ourselves the best possible chance of enjoying a Christmas that is more normal but also safe, and of avoiding a New Year hangover of spiralling cases. Please, and I really hope this will be for one last time in this pandemic, let's all pull together, do what is necessary and get each other and the country through this winter into what we all hope will be a much brighter spring.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 40 minutes for questions, after which we'll move to the next item of business. And I'd be grateful if members who wish to ask a question were to press the request to speak buttons now. And I call Douglas Ross.
Thank you, Presiding Officer. As we wait for more information on the latest COVID variant, there are actions people can take right now to protect themselves and their families. And I want to encourage everyone who can go out and get it to get the vaccine. And if they have symptoms, to get a COVID test. And there are actions the government can take right now to tackle the huge challenges facing Scotland's NHS. Today's monthly accident and emergency statistics are the worst on record. Fewer people are being seen on time than in any month since the SNP came to power. We have repeatedly warned that Humza Yousaf's flimsy winter NHS plan was inadequate. The First Minister previously accepted there was a crisis in Scotland's NHS. So does she now accept that her government has failed to do enough to prevent this crisis escalating, when hundreds of patients every week are left waiting more than half a day to be seen in our hospitals? Turning to the COVID situation, a school in Paisley has been forced to close because of a number of absences. It's a situation that, while it may be necessary in extreme circumstances, nobody wants to see happening. In the early stages of this pandemic, there was consensus across the political parties in this chamber that children's education must come first and closing schools should only ever be a last resort. So will the First Minister confirm that remains her government's position? And can she also say that no plans for school closures on a national basis have been discussed by her cabinet? And finally, doctors, including my party's health spokesperson, are warning that new guidance issued by the government to GPs will reduce the number of people being seen face-to-face. The guidance means that every patient seeking an in-person meeting will now be asked an extra 9 questions by a member of staff before they receive an appointment. Dr Andrew Buist, Chairman of BMA Scotland's GP Committee, has said, and I quote, "We see 1 million patients each month face-to-face in our GP surgeries. I don't think we can maintain that if we're having to do this new process." So can the First Minister tell us how many fewer people are going to be seen face-to-face because of her government's new policy?
First Minister.
I'll come back to the clinical guidance around GP access later on. Let me run through the other points, Presiding Officer. On accident and emergency, like probably every other country in the world right now, the pressure of this pandemic is creating real challenges in unscheduled care in our NHS and, of course, in scheduled and planned care as well. We are no different to other countries in that respect. In fact, though, notwithstanding that, while our accident and emergency performance is nowhere near where we want it to be, our accident and emergency units are still performing better than counterparts in other UK nations. But we will continue to support our A&E departments and our NHS generally to cope with the current pressure and then to recover to normal as we come out of this pandemic. But in order to do that, it is really important not just that we drive down, contain first of all, and then hopefully drive down COVID cases, but take measures to keep the NHS as safe as possible from the ingress of COVID cases into it. So I'll actually come to the issue of GP clinical guidance right now. This is clinical guidance, not a government policy. and it is about screening patients to ensure that if they are accessing GP practices physically, then in the process of doing that, we are minimising the risk of COVID getting into those practices and creating perhaps outbreaks. Now, GPs have expressed some concerns about that. We will listen to that to see whether that can be done more flexibly. But it is inescapable in the midst of this pandemic, in the midst of dealing with a variant that may be significantly more transmissible than anything before, that we need protective measures like that. Now, it's not surprising to me to hear Douglas Ross oppose anything that we have in place, because he has opposed pretty much everything we've done up until now to keep the country safe from COVID. But we will continue to take appropriate, proportionate, protective measures to keep our NHS safe and to keep the country safe. Thirdly, on schools, and this is my final point, Presiding Officer, it is absolutely the case that protecting the education of children remains a top priority. We are not discussing the closure on a national basis of schools. Everything that can be done to avoid that will be done by this government, and that is a really important principle that will drive everything we do. But that means doing some other things that, again, Douglas Ross has opposed time and again. Firstly, it means making sure there are sensible mitigations in schools, like face coverings, which nobody likes but are essential. Douglas Ross has repeatedly opposed the use of face coverings in schools. And secondly, that we do what is necessary in the wider community to keep control of COVID. Again, most of the things we've done to try to achieve that have been opposed by the Conservatives. So we need to continue to take sensible actions, proportionate actions, but we are again in a really serious juncture of this pandemic, and it demands serious government, serious decisions, and it certainly doesn't demand opportunistic opposition.
Anna Sarwar.
I send my condolences to all those who have lost a loved one, and I want to put on record my thanks to all those on the front line, in particular all our vaccinators who continue to help protect and save lives. In the last few days, I've been contacted by a number of people who, having booked an appointment, turned up at the vaccination centre on time, stood in a queue, but as it reached the closing time, they were turned away. Can we ensure that all those that queue on time will get their vaccination? For lots of Scots, the respite that comes, or the brief respite that comes from the winter break, will be a chance where they find the time to go and get their booster vaccination. So can I ask the First Minister what the plans are for over the Christmas period and whether there will be more drop-in centres? The First Minister is right to say that the NHS continues to face huge pressures. Stats published today show 5,700 nursing and midwifery vacancies, over 400 consultant vacancies, the worst A&E waiting times on record, and when we are supposed to be catching up, there are 43% fewer planned operations compared to pre-pandemic levels. But perhaps most shocking of all is the news that almost 2,000 children have been waiting over a year for specialist mental health services. Many issues in the NHS predate the pandemic, but NHS catch-up must be part of our national emergency response. So can the First Minister give a commitment that she will come every week, just like alongside her COVID statements, and bring detailed updates on the steps being taken to address these emergency issues in our NHS so we can have that catch-up programme that Scotland needs?
First Minister.
I and my ministers report regularly to Parliament on the whole range of NHS pressures and actions that are being taken to address and resolve those pressures, and that will continue. In fact, I would strongly suspect over the winter period that will, if anything, only intensify. In terms of the specific points raised on vaccination, last week I explained the issue that we had last week that led to a relatively small number of people being turned away because we were in the process of changing the protocols and the guidance from saying that there had to be a 24-week gap between second doses and boosters to a 12-week gap. We now know we had that problem for a short period because we were doing that more quickly than other governments. In England, for example, it may be the 13th of December before that advice is operationalised. In addition to that, for example, in parts of Glasgow on Friday, there were some people, because of the busyness of vaccine centres, turned away at closing time. And again, action has been taken to ensure that there is the capacity in terms of vaccinators in clinics to make sure that that is dealt with. I have always said that with a a programme of the scale and complexity of this one, there will be problems at times, and we work to resolve those problems as quickly as we can. But again, I would ask everybody to acknowledge, not for the sake of the government, but for those working so hard to deliver this programme, that we are the most vaccinated part of the UK. Today, I suspect when the figures are published, we will see that we've gone over 40% of the over 12 population having received a booster vaccination. That is considerably ahead of any of the other UK nations, and that is to the credit of those organising this programme, resolving the problems when they arise, and to those who are administering vaccines in the centres in every part of the country. On the point about the festive season, part of the work we are doing right now is to ensure that what would often happen over the festive season is that activity drops, that we avoid that as far as possible over the Christmas and New Year break, that the run rate of vaccinations per week maintains at the level we are right now, so that we can keep that flow through to the end of January, when we want to have completed the booster programme. So every effort has been made to ensure that all of that is taken full account of. And finally, in terms of staffing in the health service, recruitment in our health service and social care, similar to recruitment across our economy right now, is a significant challenge, partly because of the pressure that has come from ending freedom of movement. So that affects the National Health Service, and we must be blunt about the reasons for that. But notwithstanding that, the figures published today show that we have a higher number of people working in the National Health Service than ever before. Since this government took office, I think almost 30,000 more people working in our National Health Service. The ninth, perhaps, I think, consecutive year of an increasing NHS workforce. So that is what this government has delivered. It is what we are focused on delivering more of. We are looking to accelerate recruitment, and the Health Secretary, when I came into the Chamber, was just talking about some of that work that is underway. So we continue to focus on these challenges as we go through this winter, and remind people that all of us have a part to play to help relieve the pressure on the NHS.
Beatrice Wishart.
Thank you, Presiding Officer, and I thank the First Minister for advance sight of her statement. This morning we saw further evidence of the pressure that exists in the NHS. Nursing and midwifery vacancies are up 19% since the summer, with well over 5,000 posts empty. Mental health waiting lists as long as your arm, and in the region of 265,000 operations have now been lost to COVID. And that matters to people like my constituent, who has been off work since April, in agony, now on reduced pay, but told their operation won't be for another year. The backlog is only getting longer. Operations remain well below pre-COVID levels. So what can the First Minister tell my constituent?
First Minister.
What I would tell Beatrice Wishart's constituents, and indeed anyone across the country, is that the Government is investing in the additional staffing, the additional capacity, to ensure that we are reducing and recovering the backlog created by COVID as quickly as possible, and that work is continuing to intensify. But the second thing I would say to everybody, to all of us, is that the more we reduce the pressure that COVID is putting on the health service, the more we reduce the ability of COVID to delay and pause other treatments, then the less of a backlog, of a growing backlog we will create. So it comes back to my central point today. We are again at a really critical juncture in this. I wish we weren't. I wish we weren't facing this again in the shape of the new variant. But it is a moment where all of us have a part to play to reduce that pressure, to reduce the number of cases overall, and that will help reduce the pressure on the NHS and allow the NHS to do more to recover that backlog as quickly as possible.
Co-Cap Stewart, to be followed by Murdo Fraser.
Thank you, Presiding Officer. We know that vaccines are the best line of defence against COVID, especially as we face the new variant. Can the First Minister therefore provide an update on the progress being made with extending the booster programme for under 40s?
First Minister.
Well, we have said that our aim and target, very clear aim, and we've got a lot of confidence in delivering this, given the progress of the booster programme so far, is that we want to complete the booster programme, and that includes for under 40s, for those over 18, by the end of January, and that is what we are working to do. That involves all of the things I spoke about in my statement: increasing the vaccination workforce. We've already increased it and will seek to go further, increasing the capacity for vaccinations, but also making sure we are doing what is necessary to generate the demand, making sure that those who are eligible, when they are eligible, come forward and get vaccinated. So all of that is really important work. And of course, all MSPs can help us with that by getting these messages out in their own constituencies.
Murdo Fraser, to be followed by Kenneth Gibson.
Thank you, Presiding Officer. The First Minister highlighted the importance of the vaccination programme, and I'm sure we would all pay tribute to the NHS staff and the community volunteers who are working so hard to deliver this. But we are still seeing too many unacceptable delays. I was contacted by constituents who advised me that at the Pitlochry vaccination centre on Saturday morning, there was a 3-hour delay for those turning up to be vaccinated, and many of those who had turned up were having to queue outside in inclement weather. We have the vaccines, but we don't have enough vaccinators. So what more can be done, for example, to call upon recently retired medical staff or perhaps medical or nursing students with adequate training who could come in and fill up these gaps?
First Minister.
I'm not sure if Murdo Fraser paid attention to the statement I made. I said we have already, through recent recruitment efforts, added the equivalent of 300 additional vaccinators, and that is through a range of different approaches, some of which are the ones Murdo Fraser has already talked about. So this is work that is already ongoing. I accept that because we are seeking to encourage people to make appointments, some people will come forward for vaccination without an appointment, so there is always a balance every single day in every vaccination centre to strike between supply and demand. There will be some days where more people are coming forward than anticipated, which in some ways is a good thing, where that is putting pressure on the supply and is leading to regrettable delays in people being vaccinated, or some cases, albeit a small number, of people being turned away. We are working hard, health boards are working hard to avoid that, but in the overall scale of this programme, these are relatively small issues and issues, unfortunately, that sometimes are unavoidable. The overall programme is going exceptionally well. I keep making the point because I think it is really important to give the credit to the teams across the country. We are not marginally, now significantly ahead of England, Wales and Northern Ireland in terms of the delivery of boosters. That doesn't mean we can let up. We've got to keep pushing ahead with that. But that suggests to me that the programme is going well, that we are doing the right things. We just have to do more of them, and we have to make sure we stay on it. And that's exactly what we intend to do.
Kenneth Gibson, to be followed by Pam Duncan-Glancy.
Thank you, Presiding Officer. First Minister, a hugely disproportionate number of people being treated in intensive care units with COVID chose not to get vaccinated. This is a significant and ongoing adverse effect on the NHS, including its capacity to treat patients with other illnesses. We are the most vaccinated part of the UK, but despite the exhortation of ministers over the last year of the importance of everyone being vaccinated, a stubborn minority refuse. What further steps will the Scottish Government take to increase the number of people being vaccinated to protect the NHS and wider society?
First Minister.
Well, I've already set out today some of the steps we're taking to generate additional demand, to get to people the blue envelope letters that I spoke about, to particular age cohorts, to get to people who haven't yet been vaccinated, to encourage them that even at this stage it's not too late and they should do so. We'll continue to use methods like that to encourage people to come forward, and of course everybody by the end of January will have been offered everybody over 18 by the end of January will have been offered the booster vaccine. What I would say pretty bluntly to people, if you are eligible and able to be vaccinated right now and you're choosing not to be vaccinated, then you're being deeply irresponsible. I would say you're being selfish, you're putting your own life much more at risk, and you're putting the life of everybody you come into contact with at risk. And that was true before the emergence of Omicron. It may be even more true now. So please, for your own sake, get vaccinated. But if you're not going to do it for your own sake, then do it for the sake of others you're coming into contact with. And for goodness sake, don't put their lives on the line.
Pam Duncan-Clancy, to be followed by Siobhan Brown.
Thank you, Presiding Officer. Last week, the First Minister announced a significant change in guidance, meaning that anyone who is contacted by Test and Trace in relation to the Omicron variant must self-isolate regardless of vaccination status. Can the First Minister give reassurance today that self-isolation support grant guidance will be updated to include those who have been vaccinated and have been advised they have been a close contact of someone with Omicron?
First Minister.
Yes, I can, and if there is still work to do to make that clear, we'll make sure that is done. But anybody eligible who's been asked to isolate for a longer period, if they are a close contact or a household contact of a close contact of an Omicron case, is eligible for the self-isolation support grant if they are otherwise eligible, and we'll make sure guidance is properly updated to make people aware of that.
Siobhan Brown to be followed by Gillian Mackay.
Thank you, Presiding Officer. Can the First Minister give an indication on how the new variant Omicron is being identified and tested for, and what measures do health boards have in place to identify the new variant?
First Minister.
Well, the Omicron variant has a mutation which leads to what people have heard me refer to previously, the S-gene dropout. And while the S-gene dropout in a PCR sample is not conclusive of Omicron, it is highly indicative of it. Previously, that used to be what indicated presence of the Alpha variant, but the Alpha variant has more or less disappeared from circulation in Scotland. So now, if a PCR test has the S-gene dropout, then that is indicative of Omicron, and that gives an early indication of the presence of that variant. All PCR samples from test sites in Scotland are processed by the Glasgow Lighthouse Lab, and it can detect this S-gene dropout. And health protection teams are right now treating all such cases as if they were Omicron confirmed in their public health response, and that will then influence the approach to contact tracing and isolation. And then from the PCR S-gene dropout, cases that have that, or many cases that have that, go through whole genomic sequencing, which then confirms absolutely the presence or otherwise of the Omicron variant. So the presence, or rather the absence of the S-gene in these tests is a really important way of quickly identifying that a case might be Omicron, and then making sure that the public health response is appropriate on the basis of that.
Gillian Mackay to be followed by John Mason.
Thank you, Presiding Officer. As the First Minister outlined in her statement, continued home working will be a vital tool in our efforts to suppress the virus. I'm sure we've all read comments online from workers concerned at the expectation to be back in the office. What support will be offered to employees who were working from home earlier in the pandemic, but who are now feeling under pressure and are being required to come into work by their employers?
First Minister.
I'm making very clear today what the Government is asking of employers. I mean, don't get me wrong, I understand how difficult this is for employers. I also understand that there will increasingly, much different to the start of the pandemic, be mixed views amongst workers about the desirability of home working versus office working. I appreciate many people who've been working at home for long periods actually want to get back to the office. But we know that maximising home working and therefore reducing some of the contacts that go around office working can help stem transmission. And at this point, this is really important. So to support workers to work from home, we are sending a very clear message to employers today to make sure that that is being facilitated wherever possible. And to make this easier for people to understand the message, if your staff were working from home at the start of the pandemic, please, for the next few weeks, we're saying at the moment until mid-January, where we can review this again, having come through this next very difficult period, please enable staff to work from home at this stage. It can, I believe, and we've seen this before, make a significant difference and hopefully help us avoid the need for any more onerous restrictions.
John Mason to be followed by Jamie Halcrow-Johnson.
Thank you. Concerning vaccine certification, I've been asked by constituents how and when their booster jag will appear in the certification, and I wonder if the First Minister could say anything about that.
First Minister.
Well, booster information will appear in the international section of the COVID status app from the 9th of December, so later this week, Thursday, along with negative test status from PCR tests and recovery certificates for those who have previously tested positive for COVID. These have been developed in line with the standards set by the European Union and are for use for travel purposes only. At this stage, non-app users will be able to access their booster information on paper or PDF from the week beginning 13th of December, so from next week, and we will give further information in due course about the incorporation of booster vaccinations for domestic purposes.
Jamie Halcrow-Johnson to be followed by Marie McNair.
What assurances can the First Minister give to Scotland's small businesses that her government's upcoming budget will help insulate them from any loss of business caused by the Omicron variant?
First Minister.
Well, right now in Scotland, small businesses in certain sectors have 100% rates relief, which they wouldn't have if they were situated south of the border under the Conservative government. So I think we can take from the actions in place just now that this is a key priority for the government. I know it is a particular priority for the Finance Secretary, who of course will set out the budget to Parliament later this week.
Marie McNair, to be followed by Katie Clark.
Thank you, Presiding Officer. The First Minister will be aware of the strain that NHS dentists have been under during the pandemic. I've been contacted by local dental practice and patients who are concerned over NHS dental provision. In light of the new variant, the full resumption of services will of course have to be done cautiously. Can the First Minister outline what funding has been made available to support practice recovery and remobilise our dental services in a way that is safe?
First Minister.
Well, obviously, dentists provide essential services and we're doing everything we can to support NHS dentistry. We've already provided £50 million of financial support payments throughout the pandemic and additional funding for PPE to help dental services in these circumstances. From February next year, we'll bring in new and increased fees for dentists for a range of treatments, which will support them in their efforts to clear the backlog in routine care that built up during the pandemic. And these plans build on more recent announcements for funding for new dental drills and for ventilation improvements, which are about helping NHS dental teams see patients safely in dental settings.
Katie Clark, to be followed by Joe Fitzpatrick.
Seafarers returning to Scotland from work overseas are still required to quarantine in hotels at a cost of £2,285, with some employers refusing to meet the cost. This is not consistent with other sectors such as offshore or indeed the rules in the rest of the UK. Has the First Minister had the opportunity to look at this issue, and would she be willing to meet with the relevant trade unions to discuss how rules can be made consistent?
First Minister.
The Government will certainly be happy to talk to trade unions about any concerns they have here. I know we have understandably had concerns raised about seafarers in the past. We've looked at those concerns. Clearly there is a need here to have protective measures in place, but we don't want to have measures in place that are any more onerous than necessary. I know these are matters that we look at on a regular basis. I will write to the member, or ask the Health Secretary to write to the member with an update on particular considerations around managed quarantine for seafarers, and yes, be happy to discuss any remaining concerns with trade unions.
Joe Fitzpatrick, to be followed by Pam Gossel.
Thank you. The First Minister will be aware of calls from the People's Vaccine Alliance for action to tackle vaccine inequality and ensure that life-saving vaccinations can be made across the globe. Given this is a global pandemic requiring a global response, will the First Minister join me in urging Boris Johnson to take action, including backing proposals to waive intellectual property rules to ensure equitable access to COVID-19 vaccines to protect the health of all people all around the world?
First Minister.
Yeah, I do support the calls of the People's Vaccine Alliance. I certainly call on the Prime Minister to take whatever action he can to ensure that we get vaccines equitably to the population of the world as quickly as possible, but also take very seriously the responsibility on the shoulders of my government to make sure we are doing everything possible. COVID is a global crisis. It's very understandable that often we focus on the implications for ourselves in our own country, but it is an unprecedented global crisis. Earlier in the pandemic, the government allocated funding for our own international development budget to provide COVID support for partner countries Malawi, Rwanda, Zambia and Pakistan. The UK also participates in COVAX, which is an important way to help other nations access vaccines. But it is fundamentally the case, as Omicron is reminding us, that until everybody across the world is safe, none of us are truly safe. So we are very keen to explore further routes that support equitable access to vaccines. I will write to the Prime Minister on this to encourage him to take whatever action is necessary, but also to offer the full cooperation of the Scottish Government in doing so.
Pam Gossel, to be followed by Rona Mackay.
Can the First Minister tell us when lateral flow devices will be more available for pick-up from more accessible places like shopping centres, supermarkets, sports grounds and even petrol stations?
First Minister.
Well, as I said last week, local authorities are planning, and I'm sure some of them are doing it already, to make lateral flow devices accessible in shopping centres, garages, garden centres, anywhere that they think is appropriate and where it may be convenient for people. But I would appeal to all members, including Pam Gossel, not to give the suggestion to the population right now that lateral flow devices are not easily accessible, because they really, really are. You can order them online. You order them one day, they will arrive through your letterbox the next day. You can go to a local pharmacy and pick up LFD tests. You can get them from local test centres. We should be uniting to tell people that it is really easy to get LFD tests, and uniting to ask people to use them before mixing with other people. They're also really easy to use. And I'd repeat my request to members across this chamber to lead by example and to say publicly that they are testing themselves every day, and certainly before socialising with others over this festive period. Please let us get the message across. They are easy to get, they are easy to use, and using them regularly and repeatedly will really help us break the chains of transmission.
Rona Mackay, to be followed by Martin Whitfield.
Thank you, Presiding Officer. No one wants to see further restrictions, and I welcome the cautious approach being taken. Can the First Minister provide any further information as to the steps being taken to continue to maximise public awareness of the vital measures which remain in place?
First Minister.
Well, we'll continue to take all opportunities, from statements here, media statements, asking members across the chamber to communicate these messages in their constituencies, to get all these messages across. In addition to that, our public awareness campaign will intensify over the winter period. The current campaign, Living Safely for Us All, will run until the 12th of December. That reinforces the importance of key safety behaviours, and then a new Living Safely This Winter campaign will launch on the 13th, and that will run throughout the festive period, and that will focus on the behaviours we're asking people to adopt over this period to help protect each other, and that will include testing before travelling, socialising, visiting busy places, visiting other people in their houses, taking a PCR test if showing symptoms, getting vaccinated, and of course wearing face coverings and following all the necessary hygiene advice.
Martin Whitfield, to be followed by Christine Graham.
I'm grateful, Presiding Officer. Test and trace has all been but abandoned in our schools. Pupil testing is all but non-existent. For the week ending the 28th of November, just 2.6% of pupils 12 to 17-year-olds were tested. Siblings are not being required to isolate where one has COVID. Public health no longer liaise where there is an outbreak, and the fire doors and the windows are open in our classrooms as temperatures are dropping. Yet the Scottish Government Clinical Director this morning talked about the risk of school closures. When will we see a return to the support that our teachers, staff, pupils and their parents need to keep our schools open safely?
First Minister.
With the greatest respect, that's a gross mischaracterisation of the position. Over the period from much earlier this year to now, we have gradually eased up some of the measures in place to avoid the need for mass isolation of classes and for the closure of schools, which many members across the chamber raised concerns about because of the undeniable impact that had on children's education. That is not the same as saying test and protect. It's not test and trace, it's test and protect, of course. It has disappeared from our schools. That is not the case. There has been continued targeted approaches to contact tracing and isolation in our schools. Given the new variant, of course, there is now enhanced contact tracing and isolation requirements, which will, as we are already seeing, unfortunately, be likely to have an impact on classes and schools in different parts of the country. So that proportionate, targeted approach, scaling back when we can to reduce impact on education, but scaling up again when necessary, as is the case now, is the one we will continue to take. And on testing, we can't force children or staff to test, but we strongly encourage, as we are doing the entire population right now, to test using LFDs regularly and repeatedly. And again, I would ask all members to help us get that message across through their own communication in their constituencies.
Christine Graham, to be followed by Finlay Carson.
Thank you, Presiding Officer. Further to the First Minister's answer to Pam Godsall, can I suggest there are two big advantages in distributing through supermarkets and garden centres. It's so easy to pop something into your shopping trolley. It's almost casually done. And secondly, it will increase education, the importance of flow before you go.
First Minister.
I said last week that we are going to, through local authorities, be making them available in shopping centres and garden centres. So I'm not arguing against that for a moment, but I will repeat what I said to Pam Godsall. in arguing or sort of saying, and I agree entirely with it, that we should extend the access to LFDs, please let us not inadvertently send a message to the public that they're not easily accessible, because they are. So let's say to people, get them now. Don't wait for them becoming available in garden centres or shopping centres. They will do over the course of the festive period. But go onto NHS Inform now, get the test, use the test. It's possibly, next to vaccination, the most important thing we can do to try to stem this transmission.
Finlay Carson, to be followed by Stephanie Callaghan.
Thank you, Presiding Officer. Given the potential risk of further spread of the new variant, can the First Minister set out what contingency plans are in place to provide additional support to care homes to allow our elderly loved ones to safely see our friends and family over the Christmas period?
First Minister.
We'll keep the protections in place around care homes under very, very close review. What I would say now is the most important protection for people in care homes is the vaccination programme, and that's why we have all through the vaccination programme prioritised care homes in the rollout of the programme. But to anyone, staff or visitor, who is accessing a care home right now, it is even more important than it is for anyone else, and it is vitally important for everybody to make sure you are vaccinated and to make sure you test yourself before you go. That makes sure we minimise the risk of the virus getting into care homes, and that's always been important, but it is particularly important in the face of the Omicron variant.
Stephanie Callaghan, to be followed by Jeremy Balfour.
Thank you, Presiding Officer. With around a third of Scotland's Omicron cases currently being reported in Lanarkshire, can the First Minister advise any additional interventions in place across Lanarkshire to mitigate against more rapid community transmission?
First Minister.
The local health protection teams in Lanarkshire have been working hard through enhanced contact tracing, isolation, targeted testing to try to limit transmission. The same approaches will be used in other health board areas where we are seeing cases. I said earlier on, we now have cases, although in some health board areas this may only be a single case at this stage, but we have confirmed cases in 9 out of 14 health board areas. So we're seeing transmission of this variant in pretty much all parts of the country, and I think it's important to be mindful of that. There is also, and this is certainly the case with Lanarkshire, and it's something we all have to be mindful of, and certainly the government has to be mindful of as we consider the data and any implications of that in the days ahead. Many of the cases right now we know are associated with large events, so there is, I know, within the scientific community a concern that this variant has a particular super spreading risk associated with it. So again, if you're attending events, make sure you test before you go, and even though it's not the law to physically distance anymore, just be mindful of distance between people in other households. If we take sensible precautions right now, then we have a chance of stemming this and avoiding the more onerous precautions that otherwise might become necessary.
Jeremy Balfour, to be followed by Liam McCarr.
Thank you, Presiding Officer. First Minister, you said a moment ago the importance of taking lateral flow tests, and we all agree with that. But for those who have disabilities, it is becoming increasingly difficult to do that. I have a cross-party group on disability today at lunchtime. A person who is visually impaired cannot see the result. Thus, he cannot go out, and his wife is also visually impaired. I and those who have upper limb disability cannot do the test. We can't go to a pharmacy because they won't allow us to do it there. What advice do you give to those with disability that they wanted to use the test but have nowhere to do it safely?
First Minister.
That is a very fair and legitimate point, and we need to consider a range of different ways, because there will not be one particular measure. It's so serious a point that I want to ask the Health Secretary to consider that more, to see if there are ways in which, as well as spreading the accessibility of LFDs, we can look at providing ways in which these tests for people with particular disabilities can be taken and processed. So if Jeremy Balfour is willing to wait, we'll look at that quickly over the next couple of days and come back to him with more detail afterwards.
Liam MacArthur.
Thank you, Presiding Officer. The First Minister will be aware that there are different arrangements in place in the Island Health Board areas for booking booster and third vaccinations. In her statement last week and again this week, I don't think she's necessarily drawn a distinction between the arrangements nationally and the arrangements for Island Health Board. So I wonder if she could put on the record that distinction, that those in the islands will wait for a letter about their vaccination rather than booking it through the portal as those in mainland Scotland will do.
First Minister.
No, again, that is a very fair point. I think perhaps 2 or 3 weeks ago I did draw that distinction. Liam MacArthur is right to point out that I've not necessarily drawn it clearly enough in recent weeks. So the island health boards are not using the online portal, so people living in Ireland should wait for the letter with the appointment for their booster vaccination. Not all parts of Highland are now using the portal, but not all parts of Highland Health Board are using the portal. So again, there will be some people there who will get a letter. So it's a clear and important distinction to draw. If you live in the Western Isles, on Orkney or Shetland, you don't book your booster online. Your health board will contact you with an appointment.
Thank you. That concludes First Minister's statement. COVID-19 update. There will be a very brief suspension.
Okay, colleagues, the next item of business is a statement by Humza Yousaf on the independent review of Murray Maternity Services. The Cabinet Secretary will take questions at the end of his statement, so there should be no interventions or interruptions. And I call on Humza Yousaf for around 10 minutes, Cabinet Secretary.
Thank you, Presiding Officer. I'm delighted to be able to update Parliament and members on the action that will be taken following the publication of the independent review of maternity services in Murray, namely our next steps for the reintroduction of consultant-led maternity services at Dr Gray's Hospital in Elgin. I'm currently considering the 37 recommendations in greater detail, and I want to take the time to do this, primarily in discussions with NHS Grampian, NHS Highland, but importantly local people, the local community, including of course elected representatives. At this stage, it's important to say that the Government hasn't ruled out any of the options presented. Members will be aware that I've been committed to the reinstatement of consultant-led maternity services in a safe and sustainable way. That's a commitment that was reiterated as part of our manifesto, and members will recall the members' debate from Douglas Ross on this very topic back in June. I very much welcome this much-anticipated report. In particular, I welcome the thorough and consultative approach that the review team took. I met with Rafe Roberts, the Chief Executive of NHS Borders, who led the review on Friday. He told me that around 300 individuals contributed their views, and the team held nearly 50 evidence sessions, and the outputs of these discussions excuse me, are very evident throughout the report. I would like to give my thanks to Mr Roberts, to the review team for the thorough and substantial report that they have produced. I'd also like to thank the members of staff and professionals from across NHS Grampian, NHS Highland and the wider Scottish Health Service for their contributions. In particular, and most importantly, as I say, I'd like to thank people, the local people, local representatives of course as well, but most importantly the women, the families who have shared their views and their own experiences. Without them this report would not have been possible, certainly wouldn't have been as impactful and as powerful. This afternoon I will speak to the report, but I'm keen not to preempt any final decisions that I will make in this regard. And I will then say a bit more about the immediate actions that have already begun, and then, of course, I will touch upon the medium and long-term issues, which I know are of great importance. I'm heartened, I have to say, by the response to the report thus far, with both NHS Grampian and Highland welcoming the report and signalling their intention to work together and with the Scottish Government to work through the challenges for any implementation of the recommendations. Keep Mum, who led the campaign and continue to lead the campaign for maternity services, have also responded, I think, very fairly and positively. They welcomed that the voices of women and their families have been heard in the report. I know that people need to have time, of course, to digest and consider the findings, and that, of course, they are waiting for a strong signal from Government about the next steps and, indeed, implementation. When we appointed Rafe Roberts to chair the review in March of this year, we asked the review team to work with NHS Grampian, with NHS Highland and stakeholders with an interest in local maternity services to explore the best obstetric model that will provide safe, deliverable, sustainable and indeed a high-quality maternity service for the women and families of Murray, in line with the Scottish Government's ambition that's described in the Best Start, a 5-year plan for maternity and neonatal care. For those who have had the opportunity to read this extensive report, I'm sure you will agree that it is comprehensive, but it's also very grounded in pragmatic and very pragmatic and realistic. This is not the first report, of course, I know, into maternity services at Dr Gray's in recent years, and that is very important moving forward. We acknowledge the work that's already underway in NHS Grampian, again through the Best Start North programme, to look at maternity services across the whole of the north of Scotland. As I say, what I'd like to do this afternoon is set out how we intend to move forward with the immediate and short term, but also I will touch upon, of course, the medium and long term as well. The report itself does set out a preferred approach. It has a detailed plan on how this could be taken forward, but the report also has a number of supporting recommendations, namely on existing service provision. The report highlights actions that will support the safe reintroduction of elective C-sections at Dr Gray's. On culture, it talks of a cross-site working for staff in the commissioning of a cultural safety programme. It demands leadership from not just the board, but also from the Scottish Government. Mainly on infrastructure, I'd like to commit here, and today we will work closely with both NHS Grampian and Highland to secure the future of Dr Gray's Hospital, and will invest in its future development in whatever form that takes. I want to pause just for a moment to reflect on the fact that NHS staff in maternity and neonatal services, like all our NHS staff, of course, have continued to provide high-quality maternity and neonatal services each and every day for the last 20 months. I want to pay tribute to their ongoing hard work and thank them for their dedication, their resilience and determinations in the face of a global pandemic. Moving on to the immediate actions we intend to take in relation to maternity services at Dr Gray's. I was able to meet with both NHS Grampian and Highland briefly this morning, and they've expressed to me certainly their determination and commitment to take forward the recommendations in the review. I have made arrangements to travel to Murray in less than a fortnight on the 20th of December to meet with local people, including local campaign groups such as Keep Mum, clinicians and elected representatives and the health boards, again, to discuss the report recommendations with them. My office, if it has not already sent out invitations, will be sending out invitations to interested parties by the close of play today. And Douglas Ross does tell me, actually, that that date is also his wife Crystal's birthday. I'm sure she'll be delighted that he has chosen to spend it with me as opposed to her. We will work at pace with NHS Grampian to look at what is possible in the short term, including the rapid reintroduction of elective caesarean sections. This will quickly double the number of women who can deliver at Dr Gray's up to 40%, around 400 births per year. But of course, I've heard the comments from my colleagues, including Richard Lockhead, who members will not be surprised continually and often asks me and brings forward issues around Dr Gray's, that still means that the majority of women will not be giving birth in Murray, and therefore we have to look at the medium and the long term, which I know is an issue again that was raised in the parliamentary debate here in June. These discussions obviously will have to include NHS Highland also, recognising the report highlights the critical role of Raigmore, a choice for women to deliver their babies when the maternity unit has been improved and expanded. But I want to be clear, for this to be sustainable, there are a number of relevant actions that first need to take place. I know we have previously tried to implement this model, but it quickly became unsustainable, quickly became undone, and I'm determined to ensure that we have the relevant infrastructure to support change prior to any implementation. Which brings me on to the medium and longer term recommendations in the report, particularly Model 5, the development of a midwife-led consultant-supported unit that would be located in Dr Gray's Hospital in Elgin. This is an option that I was pleased to see was supported by the Keep Mum campaign group in the recent response to the report. Under this model, consultant-supported births, including emergency C-sections and instrumental deliveries, would allow up to 70% of Murray women to deliver their babies in the local community. The report highlights some of the challenges and preconditions for this model, and they can't be ignored. This model is set within the wider context of a vision for future development of Dr Gray's, which will require a clear strategic plan for the hospital, and serious practical and financial consideration will need to be worked through to support such a change. This brings me back to the commitment to reinstate consultant-led maternity in a safe and sustainable way. We want to deliver this commitment quickly, safely and sustainably, and I fully expect that Models 4 and 5 will allow us to return to consultant maternity services to Dr Gray's in such a way. But we will have to do that, not without a shadow of a doubt, in concert and consultation with the local community, with the local clinicians, and indeed with local representatives and the health boards. But it will have to be done in a way that is open and transparent from the government about the challenges, but I hope that the community will see that we will also work on that with pace. So to conclude, Presiding Officer, I could talk at length on the report, given how extensive it is, but my focus now, as I've said, is to meet with local people to discuss the findings and get on with this action. So I give them an absolute commitment that we will not waste any time, or there will not be certainly will not be a lack of pace or urgency in relation to taking forward and driving forward our work to restore consultant-led maternity services at Dr Gray's.
Thank you, Cabinet Secretary. The Cabinet Secretary will now take questions on the issues raised in his statement. I intend to allow 20 minutes, after which we will have to move on to the next item of business. And as ever, any members wishing to ask a question should press the request to speak buttons now as soon as possible, or place an R in the chat function. And I start by calling Douglas Ross.
Thank you, Deputy Presiding Officer. And I also want to acknowledge the work of Rafe Roberts and his review team. But in particular, I want to thank the women and the families and the staff in Murray who shared their experiences. The staff at both Dr Gray's and Aberdeen, I know through personal experience, are the very best we could hope for in our area. And throughout the report, they are rightly commended by everyone for everything they do. First and foremost, though, the review said the status quo was promptly considered to be inappropriate. It goes on to say about the current model that both Professor Cameron in his report and the review group believe there are potential risks to patient safety. So I have to ask the Cabinet Secretary, why have we been living with this model in Murray now for over 3 years? Can I also ask the Cabinet Secretary, does he believe the staffing and capacity can be found at Raigmore to take hundreds of additional women from Murray each year, given that the numbers transferred to Inverness has actually fallen every year since our maternity unit was downgraded and was just 16 last year? I welcome that elective caesareans will return, but does the Cabinet Secretary believe that induction of labour at Dr Gray's should also be made available if possible? And finally, will an action plan with key milestones be provided once he's looked through the recommendations, so everyone locally can keep up to date with the progress or otherwise being made? And Deputy Presiding Officer, I just wanted to finish by saying my hope is for as many women in Murray to give birth locally. As a family, we're blessed with 2 great boys, but they were both born in very different circumstances. Alistair came into this world at Dr Gray's, and after a few days of great care and support, we travelled just a few miles home with our newborn. But with James, it was a different scenario. As Crystal's labour progressed, his heart rate started to dip every time she had contractions. And for someone to be on a green pathway right up to that point, it rocked me to hear that. I tried to be strong for her because I knew it was stressful for Crystal as well. To then see your wife taken in a trolley through hospital, strapped into the back of an ambulance, and then taken through to Aberdeen, it was one of the worst experiences I've ever faced. And at that moment, you feel utterly helpless at the time your wife and unborn child need you most. And I just say this because whether it's 40 miles to Inverness or 65 miles to Aberdeen, that journey adds stress, anxiety and worry at an already emotional time. So I just hope across Parliament we can agree to do everything possible to maximise the number of women able to give birth in Murray and do everything possible to minimise those who have to leave our area to have their children. Thank you.
Thank you, Mr Ross. Cabinet Secretary.
Can I thank Douglas Ross for his questions, and can I speak to him first as a father as opposed to as the Health Secretary, that I would have hated to be in the position that he was in. When my wife gave birth to our daughter Amal, she was already in a high-risk pathway. We'd unfortunately miscarried a number of times before that, and my daughter was transverse and therefore not in the right position. And she decided just for fun to arrive 3 weeks early as well. But we were only 20 minutes away from the hospital that we had to be at. But I recognise his feelings and emotions around being helpless, let alone having to drive for the period of time in the back of an ambulance that his wife had to be transported in the back of an ambulance like his wife Crystal had to be. So as a father, as opposed to the Health Secretary, let me say just how unacceptable I find that entire situation. Because that is the question Douglas Ross asked me. He said, do I find it acceptable that we've had this model for the last 3 years? I don't find it acceptable. He's right to, on behalf of his constituents, be upset, angry and frustrated, and that's why I say that I have no issues with him characterising that and the current situation in that way. It's why I've also been impressed, I have to say, by the cross-party campaign that has been there. As I say, my colleague Richard Lockhead, you can imagine, was one of the first to phone me on Friday when the report was published to understand and to put his concerns as a local MSP, not as a government minister, but as a local MSP, put the concerns of his constituents forward to me. Douglas Ross has done exceptionally well to raise this issue in our Parliament, and I want to pay my tribute to that cross-party campaign. On the specific questions about Regmore, I asked that very question to Pam Dudek, to Boyd Roberts and the team at NHS Highland, and he will know that Regmore is going under significant development, and we have promised to invest in that development. So I absolutely believe that the additional women who may have to go to Regmore, that there is the capacity to be able to deal with that. But I will give him further assurances in and around that. His question about induction-led labour, what I would say is it's really important for me to be able to go up to Murray, to go into Dr Gray's and to be able to speak to the clinicians. I am not a clinician, and therefore it is not for me to be able to say what can be done safely. What I want to be able to say to Douglas Ross and to the community that's watching, we want that consultant-led maternity service there in Dr Gray's. We want as many women as safe as possible to give birth at Dr Gray's. We will do that with urgency and pace, but we also have to recognise the significant workforce challenges that exist. And that's why I think Douglas Ross's last point, which I'll end on, Presiding Officer, is really important, that there has to be an implementation plan, clear milestones. But I'll be upfront and realistic about that. Members might not always like the timescales, and they might challenge us and tell us to go even faster, and that's their prerogative, and so may the local community. But I'll be really upfront about the milestones and the implementation. So the next stages are visit Murray, speak to local community, local clinicians, elected representatives, and then I would hope early in the new year come forward with further detail of the recommendations we're taking forward and an implementation plan to follow.
Thank you. And I call Carol Mochan.
Thank you, Deputy Presiding Officer. I welcome the statement from the Minister, and it's positive to see progress on this issue. Progress led indeed by Ralph Roberts, the Chief Executive of NHS Borders from my own region, and I thank him and the review team for their work alongside the hard work of local campaign groups who have pushed this issue forward. excuse me, despite the progress detailed in the statement, Minister, can you offer some clarity about what will be done to solve the underlying issues, which is, as is in many other parts of the country, a lack of staff? There are 365 whole-time equivalent nurse and midwifery vacancies in NHS Highland and 465 such vacancies in NHS Grampian. There is, on top of this, a known lack of paediatricians. The statement today barely addresses this. What can be done about this?
Cabinet Secretary.
I think it's a fair challenge. It goes to the crux of the issue that NHS Grampian Highland spoke to me about today, but plans are underway by the Health Board already to increase recruitment in both health boards. But that is the crux of the issue, and it's why I have to be realistic. It would have been unrealistic of Rafe Roberts' report to suggest that Model 5 could be implemented within a few months or even within a year, because there's no way you'd be able to get the workforce to be able to do that. There's also infrastructure issues, of course, with that model that we have to develop. So I can give Carol Mockin an absolute assurance, and also to the campaigners who I know certainly will be watching today's statement, that we understand that workforce and the infrastructure of the hospital are two key issues that we have to demonstrate not just progress on, but investment in. And I've already given a commitment that we will invest in both those aspects.
Karen Adam, to be followed by Edward Mountain.
Thank you, Presiding Officer, and I want to thank the Cabinet Secretary for bringing forward this comprehensive report. But firstly, I really want to thank the people that have come forward with lived experience and shared those experiences, which must have been quite distressing for them, but have pushed for action on this. And I'm also glad to hear that there will be ongoing conversations with them. My question is actually a reflection of Carol Mockin's, and it was really, asking the Cabinet Secretary to outline the action that Scottish Government is taking to increase the number of appropriately trained clinical staff. As he's answered there in part, I was just wondering, will this also be, in terms of including Dr Grays, but as well as other rural healthcare centres? Thank you.
Cabinet Secretary.
I mean, in short, yes, and I know there's a number of issues that have been raised by members right across the country, particularly in remote, rural and island areas, about workforce retention, recruitment actually, and retention. And therefore, we're working with those health boards. We understand the unique challenges that are there, and already we have seen in some aspects an increase in the workforce. But on this particular issue and around Dr Grays, we've got to tackle that workforce challenge that is the crux of this issue, as well as the infrastructure, which is the slightly easier part. We can invest in infrastructure and build and so on, but the workforce challenge is far more difficult, and that's why we've got to make sure that there's a sustained effort for consultant-led maternity services in Murray.
Edward Mountain, who joins us remotely, to be followed by Gillian Martin.
Thank you, Presiding Officer. One of the preferred options for Murray is for a midwife-led service like Caithness has. The result in Caithness is less babies than ever before have been born there, with only about 20 to 30% of all far north births happening in Caithness. So, Cabinet Secretary, what work will the Scottish Government commission to assess if NHS Highland can truly take on the additional work without disadvantaging their catchment patients, and what the additional costs will be, and who will fund these?
Cabinet Secretary.
So it's all part of the discussions that are taking place. I did, in my discussions with Rafe Roberts on Friday, he did say to me that there's no doubt that people will make comparisons to the situation in Caithness and what's happening in Dr Grays, and I can understand why that is done, or why the interdependency and interactions are mentioned. What I would say is we are talking about two different scenarios, but in terms of the impact that the models and recommendations in Rafe Roberts' review, what impact they would have in other rural health settings, I think is a very fair question for Edward Mountain to ask, and I promise him that our conversations will be focused not just on Dr Grays, but also on some of the other rural health sites that may well potentially be impacted by any decisions that are made in relation to this review. So I'm more than happy if he wishes to be part of the conversations in this regard to take forward those discussions with Edward Mountain.
Thank you. Gillian Martin, to be followed by Rhoda Grant.
Thank you, Presiding Officer. It's very welcome that the independent review focused on listening to the women, families and service users in Murray, as well as the staff involved in delivering the services. Cabinet Secretary has outlined some of the steps the Scottish Government has taken to ensure continued stakeholder engagement. Does the Cabinet Secretary accept that mothers in rural areas must have the choice of having their maternity care close to where they live for so many reasons, not least their mental health? And can he give me assurances that their views will continue to be taken into account as decisions are made going forward?
Cabinet Secretary.
Yes, I do fundamentally agree with that point, and I spoke in my response to Douglas Ross just my own experience of that, and you know, I was very lucky and very blessed that I had the hospital where my wife gave birth was, as I say, literally 15-20 minutes away from our own home. It is a fundamental recommendation of the Best Start policy that women have care delivered as close to home as possible. But of course, that has to be balanced. I know every member understands this, but it has to be balanced in relation to the safety of both the mother and the baby as well. And the introduction of Near Me across the NHS has allowed many women to access care in the local area when they may have previously had to travel to big urban centres. In addition, the development of community hubs and community teams under Best Start will provide as much antenatal and postnatal care in the community as possible. But ultimately, of course, Gillian Martin is right. Having that care, being able to deliver your baby, give birth as close to home as possible is certainly an ambition of this government.
Next two colleagues join us remotely. Firstly, Rhoda Grant, to be followed by Emma Roddick.
Thank you, Presiding Officer. I too welcome the review, but feel for families who are rightly frustrated by delays. Therefore, it would be good to have a clear indication of the time frame for the restoration of full maternity services, Dr Grays, and in the meantime, what support is available to families who have to travel to Aberdeen or Inverness for maternity services by way of accommodation and by way of childminding for their families?
Cabinet Secretary.
These are all very, very fair points. For me, I completely accept the desire of the local community and other stakeholders that have an interest in this matter to see a detailed implementation plan from the government. So we will do that. As I've said a number of times in this chamber already, the first instance I'd like to meet with the local community, and that includes local representatives. And if I haven't invited you and you're a local elected member and you'd like to be part of the discussions, please get in touch with my office. I have no issues with inviting whoever to that conversation. Then, of course, we will give detail of the recommendations we are seeking to take forward. And then, of course, alongside that, we would look to plan, bring forward an implementation plan with key milestones. And Rafe Roberts in his review goes into the detail of that, of those timescales he thinks would be involved. You can imagine, as Cabinet Secretary for Health, I want to try to push those as much as I can with pace. So I will ensure, on Rhoda Grant's second point around what support is available for women and families who may have to travel to Aberdeen or to Raigmore. I will look into that. If we can do anything further on that, I'd be very open to that. I think, again, it's a fair request, particularly if there's accommodation costs as well as travel costs that are involved. So I could look into that matter offline.
Thank you. We've got 5 minutes and 5 speakers, so I think succinct questions and responses as far as possible. First, Emma Roddick, to be followed by Ariane Burgess.
Thank you, Presiding Officer. The delivery of these recommendations within the timescales set out will, of course, take time and, critically, dedication by all those involved. So can the Cabinet Secretary give an update on discussions with NHS Grampian to ensure that the board has a full leadership team in place in a timely manner?
Cabinet Secretary.
To be brief, I had a discussion with the Health Board this morning. I'll meet with them again, as you'd imagine, on the 20th of December as well. But I can assure Emma Roddick that the points that she raises are very much part of the discussion that we're having. And of course, the Health Board's input into this will be of vital importance as we progress these actions.
Thank you. Ariane Burgess, to be followed by Audrey Nicholl.
The independent review found that maternity services are key to the wider economic and community well-being of the population, so it is vital that Dr Gray's Hospital is supported to improve its ability to provide high-quality maternity care for local families in Murray. This review is not the first. The 2019 Alan Cameron report found that working relationships in the Dr Gray's maternity service were dysfunctional. and damage to the extent that they may impact upon patient safety. I'd like to ask the Cabinet Secretary whether the Scottish Government is supporting Dr Grace to implement the recommendations from that review, particularly the recommendation to develop a full package of support for all staff who have been adversely affected by the issues within the Dr Grace maternity service, so that
Cabinet Secretary.
these recommendations do not get lost as work to implement the new recommendations begins.
Yes, in short, we will not ignore previous recommendations, but I would say, and I'm sure Ms Burgess has done this, but there's a fair bit of detail on culture within Rafe Roberts' report, and of course we'll take forward those recommendations too.
Thank you. Audrey Nicholl, to be followed by Jamie Halker-Johnson.
Thank you, Presiding Officer. Over the course of the pandemic, we've seen the benefits that services such as Near Me, that the Cabinet Secretary mentioned a short time ago, can deliver to reduce the need for in-person appointments. Can the Cabinet Secretary outline what role he envisages such technology may have in the delivery of services in Murray going forward?
Cabinet Secretary.
Just to be brief, and as part of my previous answer, an answer to a previous question I mentioned, Near Me, I do think technology absolutely has a role to play in possible antenatal care, postnatal care as well. But that doesn't detract, and we should be very clear about this, doesn't detract from the desire of women, families, the local community to give birth as close to home as possible. So technology is absolutely a great enabler, but of course that does not take away from the desire of women and families to give birth as close to home as possible, which is what we want to progress through this report.
Jamie Halker-Johnson, to be followed by Stephanie Callaghan.
In the interest of brevity, can I ask the Cabinet Secretary, given the number of patient transfers that have had to be conducted, sometimes on short notice, to either Regmore or Aberdeen, what impact does he think the ongoing problems have had on an already overstretched ambulance service in the Highlands and Islands?
Exemplary. Cabinet Secretary.
I suspect it does not help, which is the obvious answer that I would give to Jamie Halker-Johnson. So certainly this is part of our consideration about how quickly we can ensure more births take place at Dr Gray's, and indeed closer to home as possible for people, whether they're in island communities or in remote and rural communities too.
Thank you. Stephanie Callaghan.
Thank you, Presiding Officer. A section of the recommendation references the importance of culture to quality and safety in any service, and this is not only beneficial to service users, but also of equal importance to staff. Can the Cabinet Secretary give an indication of the work that will be required to progress the delivery of a cultural safety programme?
Cabinet Secretary.
In the interest of brevity, I'm probably better writing to Stephanie Callaghan with the detail of that, but what I would say is she's right to highlight this. As I said in my response to Ms Burgess, that the extensive report from Rafe Roberts goes into the importance of culture in the workplace, which I think is a vitally important part. So we can focus often on the clinical expertise and the infrastructure that is needed to deliver the recommendations within the review. But what I would say is culture of the workforce and cultural safety, and that's one of the recommendations from Rafe Roberts, is to invest in cultural safety as a programme is certainly a vital part of his report, which I intend to take forward.
Thank you very much, Cabinet Secretary. That concludes this item of business. There will be a short pause before we start the next item.
Thank you. Can I remind members of the COVID-related measures that are in place and that face coverings should be worn when moving around the Chamber and across the Holyrood campus? The next item of business is a debate on motion 2429 in the name of Richard Lochhead on delivering a just transition to net zero and climate resilience for Scotland. I would invite those members who wish to speak in the debate to please press the request to speak buttons now, and I call on Richard Lochhead, Minister, to speak too and to move the motion up to 7 minutes, please.
Thank you, Deputy Presiding Officer. Scotland's journey to net zero in 2045, when we aim to end our contribution to global warming, will transform how we live and work and our economy and society. And climate change is quite rightly viewed as a threat to Scotland and the world, but how we respond is important, as it can also be a window of opportunity to a better country and improved quality of life for our people. We also have to face up to the concerns many people and businesses and communities will be feeling at the current time. And going forward, we need to reassure our people that they will benefit from good green jobs and that no one will be left behind or be expected to carry a disproportionate burden in terms of who pays for net zero. And that is why a just transition is so important. And all of us have a duty to debate these matters seriously in the times ahead and work constructively together, hopefully, where possible. And just transition matters to the entire country and its full range of jobs and people, from energy to farming, retail to construction and so on. There can be a tendency to focus on specific challenges for individual sectors and regions, but we will only deliver a just transition if it is a truly national endeavour. And at COP26 in Glasgow, I heard delegates from all over the world showing great interest in the approach we have taken here in Scotland, where we are planning to manage the transition to net zero in an orderly manner in line with the recommendation of our Just Transition Commission. This is not about simple and easy on and off switches for any particular sector or industry. The emphasis must be on the need to transition over the coming decades, and I recognise the need to ramp up delivery if we are to meet our ambitions. And that is very much the message I took from the Climate Change Committee's progress report published just today. And as well as the challenges, they note that there has been significant advancements, and I quote, in Scottish climate policy ambition over the last year, and their focus and leadership on just transition as well. And a cornerstone of... I'll take it if I can get my time added on,
Brian Whittle.
I'm very grateful for the member for taking an intervention. Would he also accept from the report this morning that they were asking for the government to be more transparent in how those policies will actually deliver the targets that you've set?
Minister.
Yeah. We have been and will continue to be transparent, but of course we'll listen to the recommendations in the report today and respond in due course. A cornerstone of a just transition is creating good green jobs and new industries. The next decade will see the jobs available and the skills required begin to look very different. And this is one reason why we have committed as a government to developing a skills guarantee for workers in carbon-intensive sectors. But there is also an opportunity to improve the quality of jobs available to people. To give one example of how all that aligns, we have committed to invest £1.8 billion in heat and energy efficiency over the course of this Parliament, and through that investment we will seek to apply fair work conditions, ensuring that new green jobs created as a result of this are good for both people and the planet. So the transition clearly impacts on livelihoods, but it also impacts on communities as well. And we know all too well the legacy of poorly managed industrial transitions in Scotland. Many have drawn parallels with the future of the North East today, home to our oil and gas industry. This government won't stand by and allow the mistakes of the past to be repeated. Communities across the country will see a fair transition to net zero. And I want to say that anyone who thinks we can switch off our use of fossil fuels, for instance, overnight, doesn't live in the real world. And likewise, anyone who thinks change is too difficult and we should continue with business as usual also doesn't live in the real world which is endangered by global warming. There is understandably much focus on Scotland's offshore sector, and I believe that the industry has an essential role to play in our transition to net zero. The pioneering spirit, the innovation, the investment, the experience is all essential for the transition to renewables and low-carbon technologies, and we have to harness that. Most of all, the people that work in the industry are pivotal and must have a voice. We must harness their skills and listen to them, and listen to their knowledge and work with them to drive our net zero transition forward. That's again one reason why we have committed to a 10-year £500 million Just Transition Fund for the North East and Moray, and why our first Just Transition Plan will have an energy focus. I thought that might attract some interventions. If time's added on, yes.
Minister, which member are you taking an intervention
apologies,
from?
I'll take Tess.
Tess,
thank you, Minister. Will the Minister welcome the UK Government's investment in tidal energy?
Minister.
Well, I welcome any investments in our renewable opportunities, but the member will be aware there was massive disappointment that it wasn't a much greater investment which would require to move forward at a faster pace, and I hope she'll take that message to the UK Government, because the UK Government has to play its role here as well. And it can start not only by addressing that issue, but also by reversing the illogical decision it has taken to overlook the Scottish carbon capture, utilisation and storage cluster for Track 1 status, which would have supported over 15,000 green jobs alone from next year, while utilising the skills of our oil and gas sector, as demonstrated by a report by Scottish Enterprise that's just been released today. Presiding Officer.
I'll add on a bit of time for the interventions.
I'll take it then.
Liam Kerr.
Very grateful. Is the Minister aware that the selection of the carbon capture was done on objective criteria? Because he doesn't appear to be.
Minister.
Well, what I'm aware of is that Sir Ian Wood and others said that it's environmentally and economically the wrong decision, and it's like leaving your best player on the subs bench when you're playing a football match. So the whole of the North East is united against the decision the UK Government took, and is united in calling for the UK Government to reverse that decision, so we can get on with creating those green jobs and going towards our net zero targets. Presiding Officer, our net zero ambitions will generate a green jobs bonanza. In fact, it's already happening and at pace. Just last week, PricewaterhouseCoopers released a report that placed Scotland as the top performer in the UK in terms of green jobs created. From climate-savvy gin production in St Boswells to sustainable food packaging made from seaweed in Oban, our economy is changing. And we've seen, of course, Scottish-based firms like SSE, which alone is proposing private investment of over £12 billion over the next 5 years to accelerate our net zero journey, creating thousands of green jobs across the nation. And I'm sure we'll want to welcome last week's news of the Port of Nig Winter factory, which is expected to create more than 400 jobs at the site. Another example of how our existing capabilities can be directed towards the net zero transition. And I can also confirm today that our public investment through the Green Jobs Fund has seen £12.3 million awarded so far this year, and is expected to create and safeguard over 850 green jobs as well. And as numerous recent reports have highlighted, we have the potential to create hundreds of thousands of new green jobs, from hydrogen to offshore wind to decarbonising heating in our buildings. So we are on the cusp of a truly astonishing green jobs revolution in every corner of Scotland. And I can also announce that in the new year we will publish our work towards a Scottish definition of green jobs, which will help guide our activity going forward. And just to finish, Deputy Presiding Officer, I want to provide a quick update on the new Just Transition Commission. The remit of the new Commission was announced earlier in the year, and they are asked to provide both advice and scrutiny on the Government's approach to co-designing Just Transition plans for sectors and regions. I have already confirmed that Professor Jim Skia will continue in his role as Chair. We have now approached members for the new Commission, and I will be announcing the full membership next week. And I can confirm that we will be taking a dual approach to the Commission, with some members appointed for the full parliamentary term and others on a fixed-term basis to bring their expertise to a particular plan. So we must ensure, in closing, that our climate action is used wherever possible to support our broader economic and social objectives, and that's what the Just Transition is all about: avoiding past mistakes and making sure we're planning in an orderly fashion the way forward to deliver a net zero Scotland.
And have you moved the motion, Minister?
And I move the motion in my name.
Thank you. And I now call Tess White to speak to and move Amendment 2429.1. Up to 6 minutes, please, Ms White.
Thank you, Presiding Officer. The Scottish Conservatives believe in a fair and well-managed transition to net zero. It's critical to safeguarding jobs in the energy sector. It's critical to protecting the UK's energy security. And it's critical to a green recovery. Decarbonising our economy doesn't mean shutting down the oil and gas industry as soon as possible. You simply can't turn off the taps. And you can't ignore demand, which is set to continue until at least 2050. Instead, decarbonising our economy requires careful planning and collaboration between governments, businesses, workers, investors and civil society. The Just Transition Commission, which reported in March this year, has helped to focus minds in this regard. But as the Scottish Conservatives' amendment emphasises, talk of a just transition must lead to meaningful action. Professor Jim Skia, the Commission's chair, said this morning that the big message is that we really need to get on with it. The Climate Change Committee's latest report on Scotland's climate change plan is clear. Most of the key policy levers are now in the hands of the Scottish Government, but promises have not yet turned into action. In this new Parliament, consultations and strategies must turn decisively to implementation. Presiding Officer, the UK Government's landmark North Sea Transition Deal, developed in partnership with industry body Oil and Gas UK, is the first of its kind by any G7 country. It contains more than 50 actions to meet the UK's climate targets by harnessing the expertise of the North Sea sector. This isn't about managing the industry's decline, but managing its diversification to greener and more sustainable energy sources so that it can thrive for decades to come. We know that many businesses in the energy sector are already diversifying beyond oil and gas, but that they're experiencing difficulties recruiting the right technical skills. That's why implementing the People and Skills Plan in the North Sea Transition Deal is so important. We know that workers in the sector have skills and knowledge that will transition well to renewables. And research from Robert Gordon University shows that this applies to more than 90% of the UK's oil and gas workforce. The loss of their expertise would be a massive blow to our net zero ambitions. Presiding Officer, as an MSP for the North East, those families and communities supported by the oil and gas sector are at the forefront of my mind today. Yesterday, I met with representatives from the Aberdeen and Grampian Chamber of Commerce, who were optimistic about the region's resilience and recovery, yet they emphasised that there is still a long way to go. Even before the coronavirus outbreak, the North East had to contend with the oil price collapse and a significant downturn in the industry. Analysis from the Fraser of Allender Institute suggests that while other areas of Scotland have recovered pretty well, the North East is lagging behind every other region. And against this background, energy sector workers have listened to language about oil and gas from this SNP Green coalition government with alarm.
We take an intervention.
Yes.
Graham Simpson.
Can I thank Tess White for taking the intervention? Would Tess White agree with me that standing up for 100,000 jobs in the North East and standing up for energy security is not, in the words of a Scottish Government Minister, a far-right position?
Tess White.
I agree with the member. For Patrick Harvey, a Scottish Government Minister who's not here today, with a ministerial car and a salary to match, to suggest that only those on the hard right support oil and gas extraction, and that's quite frankly insulting to the workers in the sector. Patrick Harvey should try telling that to the engineer who bought a house for his family in Ellen only to be laid off. He can't now afford to pay his mortgage. To gloat about an exploration project hitting the skids when that project could create 1,000 jobs is disgraceful. And it is typical of the short-sightedness of the Scottish Greens, who would prefer us to import oil from abroad, which has a much higher carbon footprint than meet demand domestically. It's dangerous to demonise an industry, particularly when the financial and emotional well-being of workers and communities in my region is at risk. To live with the constant threat and worry of whether they will have a job next month or next year is exhausting. The oil and gas industry is not a villain. As SNP MP Stephen Flynn said last week, it should not be denigrated. Sir Ian Wood has warned politicians that politicians risk creating an adverse investment environment for the sector. There is nothing just or fair about that. And let's not forget that it is the energy companies who are investing their money, their time. I'm just in my final few paragraphs, Minister. And let's not forget that it's the energy companies who are investing their money, time and technical expertise in renewable energy sources. Presiding Officer, we all agree that we must work towards a more sustainable future, but our economy must be to secure a fair and managed transition to net zero for those people who rely on the energy sector for their livelihoods. At decision time today, the Scottish Conservatives will support the SNP motion. We are sympathetic to the Labour amendment, but its successful passage would remove our own call for meaningful action. Given the findings of the Climate Change Committee's report today, we feel it's important to press this point, and as such, we won't support the Labour amendment today. I move the amendment in my name. Thank you.
Thank you. I now call on Colin Smith to speak to and move Amendment 2429.2. Up to 5 minutes, please, Mr Smith.
Thank you, Presiding Officer. We know the clock is ticking if we are to stop the climate emergency becoming a climate catastrophe. We know that COP26 barely kept 1.5 degrees alive, and if governments don't turn their warm words in the agreement into practical actions on the ground, it will be the death knell for an ambition that's already disastrous for many islands. And we know that here in Scotland we may have challenging targets, but we still don't have a clear plan that comes close to delivering net zero by 2045, and arguably more challenging, a 75% reduction in emissions by 2030. Scotland continues to consistently miss our emission reduction targets despite significant deindustrialisation in recent years, and the longer we take to put in place a proper plan to meet those targets, the less likely any transition will be a just one. So Labour welcomes the commitment to a more long-term just Transmission Commission, and we believe it should have a statutory backing, and we do commend the work of the previous Commission. But, Presiding Officer, the Government's response to its recommendations was too timid. It has become the norm that the rhetoric isn't matched by the reality. There is still no plan to prevent the weight of climate change landing on the shoulders of the poor. Transport, for example, remains the largest source of greenhouse gas emissions, responsible for more than a third, with levels barely below 1990. Yet we have a Green SNP coalition hiking up rail fares in a few weeks and axing 300 trains a day. From May, that's 100,000 a year compared to pre-pandemic levels. And they still haven't given councils the powers as secured in the Transport Bill to run their own local bus services at a time our bus network is being dismantled route by route and fares rise and rise and rise, in fact 50% under this government. That's not a just transition. In agriculture, it's 5 years since the Brexit vote and now just 3 years until the end of the transition period for a sector that, by definition, needs time to plan, but where emissions are still flatlining. Yet there are still no details from the Government on how future farm and rural payments will deliver any managed transition, never mind a just one. And on heating and buildings, the Minister referred to an investment of £1.8 billion, but we know the bill is £33 billion, £5 billion alone for councils to refit council homes, and it's not clear that the cost won't land on the backs of rent payers. And when it comes to jobs, we all remember Alex Salmond promising that Scotland would be the Saudi Arabia of renewables, but a decade on from the SNP pledging 130,000 green jobs by 2020, the number directly employed in the low-carbon and renewable economy is just 21,400, the lowest since 2014. So, Presiding Officer, I'll take an intervention yet.
Thank you. Does the member agree that the Scottish Labour position on Cambo has jeopardised 1,000 jobs in the energy sector?
Colin Smith.
The reality is that people in the energy sector are already losing their jobs, and they're getting very little support, I have to say, from the UK Government at a time that oil prices are falling, particularly given the fact that there are no proposals or plans from the UK Government to support those workers in a just transition. So, Presiding Officer, it's little wonder that when it comes to governments, either UK or Scottish, delivering a just transition, there is scepticism even from members of the Scottish Government's own Just Transition Commission. As Richard Hardy, the Scottish Secretary of Prospect Union, said of the Government's response to the Commission's recommendations, it lacks any clear strategy for creating new high-quality jobs. He added, it's very disappointing, and unions argued long and hard in the Commission for a more interventionist approach on this key issue. And, Presiding Officer, that is exactly what we need. If the transition to a low-carbon economy is left largely to market forces, as the Conservatives want, we will repeat the devastating social and economic impact experienced by our communities when the coal mines closed. And that will need more than a government motion that pats itself on the back for a framework that frankly hasn't even yet been published. It will need a relentless focus on how a climate recovery will support those unemployed as a result of the current economic crisis and the transition that we face. It will need a bold industrial strategy that lays out how domestic manufacturing capacity must evolve to ensure the growth in domestic renewable energy production actually translates into new jobs in Scotland. It will need a jobs-first transition, which is why Labour has established our own Energy Transition Commission, focused on, as we move to net zero, how we can protect jobs and also deliver energy security. And it will need a partnership approach with those workers most affected, particularly oil and gas workers. Presiding Officer, they are not the hard right. They are not criminals that deserve to be punished. They are ordinary workers, often working in the most trying conditions to meet Scotland's energy needs with invaluable skills that will continue to do so in the energy sector of the future. Meeting with them and their employers isn't something for government ministers to slag off. Frankly, it's something that shows that you respect the fact that workers understand their industry and they have the right to plan and shape their futures. I'm therefore happy, Presiding Officer, to move the amendment in my name, an amendment that makes it absolutely clear that a transition can only be just when workers have a say in the future of their livelihoods, their communities and in their climate. Presiding Officer, it's time for a transition to a modern low-carbon economy, but a just one that genuinely puts protecting workers' livelihoods at its very heart. Thank you.
Thank you. And I now call on Liam MacArthur. Up to 4 minutes, please, Mr MacArthur.
Thank you, Presiding Officer. The purpose of this short debate is perhaps a little hard to discern, but if it provides the chance for Parliament to restate our collective commitment to a just transition that puts workers and citizens first, one that ensures a resilient economy built on green jobs, then it may yet be an hour well spent. Yet the motion itself is rather self-congratulatory. Of course, ministers like to talk of this Parliament having passed world-leading climate legislation, and I'm certainly proud of the role my party played in pushing the government to be more ambitious on the interim targets for 2030. The truth is, though, that target setting is easy. Developing detailed plans, committing necessary resources, in short, delivery is the hard but crucial part. And as today's report by the Climate Change Committee shows, once again, the Scottish Government's plans are heavy on promises but light on action. The committee criticises what it sees as a lack of detail in ministers' plans for how Scotland's targets are to be achieved if we're to make it to net zero by 2045. This is against the backdrop of Scotland having already missed its emissions targets again and again over recent years. In some areas, such as heat, we're actually going backwards. As for the Green Jobs revolution we've been promised for almost 15 years, dating back to Alex Salmond's time as First Minister, well, this is a talk that has never been properly walked. Given the lack of progress made in key areas over recent years, given the urgency of the climate emergency and given the importance of securing a meaningful just transition, the Government cannot continue, as it has been doing, making bold pronouncements, then finding someone else to blame when things aren't delivered. Key to a just transition, of course, is the creation of new green jobs. We cannot afford, nor would it be right, to leave people and communities behind, as Colin Smith, I think, rightly emphasised. To achieve this, however, will require plans that are both radical but also credible. That's why Scottish Liberal Democrats want to see home insulation declared a national strategic priority, with a target set to have all areas of the country covered by 2030. This must be matched by budgets to meet the ambition, including a doubling of fuel poverty funding and incentives for householders to take early action. An initial 5-year programme could see improvements made to 80,000 homes per year and an aim to switch 1 million homes from polluting mains gas to heat pumps by 2030. All in all, this has the potential to create an estimated 34,000 new jobs in energy efficiency. We also want to see the expertise of those in the oil and gas sector put to good use in the just transition. The sector's technical and engineering expertise will be vital in delivering our plans for warmer homes, new heat networks and hydrogen power. We support the development of a centre of excellence for carbon capture and efficient energy generation. We would involve the construction and renewables industries, along with utilities companies, in partnership with colleges, universities and planners to ensure every opportunity is taken to create an economy that is fit for the future. The potential of such partnerships can already be seen in my own Orkney constituency, where proposals have been put forward to redevelop Flotta Terminal into one of the world's first large-scale green hydrogen hubs. I had the pleasure of meeting some of those involved in this project yesterday, and the potential is certainly exciting, both in a local, national and indeed international context, further enhancing Orkney's reputation as being at the forefront of renewable energy innovation. Presiding Officer, Scotland's targets for net zero are bold, they're ambitious and they're the right thing to do. However, we need government to pick up the pace and start walking its world-leading talk, if we do have any chance of making those ambitions a reality. Thank you.
Thank you. And we will now move to the open debate. And I would advise members that we have no time in hand and therefore any interventions must be absorbed within the members' speaking time. And I call Fiona Hislop. Up to 4 minutes, please, Ms Hislop.
In 1904, the Oakbank Oil Company built the Niddry Castle Oil Works at Winchborough in my constituency. The irony is that that far long before the electrification of the nearby Edinburgh to Glasgow railway line, the works were connected to the shale mines in the area by an electric narrow-gauge tramway. For several decades in the 19th century, Scotland was the leading oil producer in the world. West Lothian has many former coal mining communities, strong towns and villages and people, but brutalised by the unjust transition of the abrupt and political end of coal mining. The consequences of generational mass unemployment can run deep and long, and despite the resilience and capability of the county, the impact can still be felt. So it's not the first time our workers and communities have faced industrial transition. Yes, the British Leyland car plant in Bathgate got replaced by inward investment with a Motorola plant and 3,000 houses. Yes, Whitburn Polkemet's smoking bin is now the Heartlands estate, but not everyone was helped, and not always with skilled work and good wages. And as the Just Transition Commission report states, this transition needs to be a national mission with social justice at its heart, something achieved by the people of Scotland, not done to the people of Scotland. A just transition with skills and training that helps secure good, high-value jobs in green industries, job security for those in industries that will play the biggest part in the transition, and with costs that do not burden those least able to pay. But you can't have detailed just transition if you don't have detailed climate change plans, and the criticism today from the UK Climate Committee must be addressed by ministers. Government can't and won't do this by themselves. It needs industry, investors, energy companies, unions and public sector working together. The £110 million facility proposed for NIG with a prospect of 400 jobs in an offshore wind factory is a major step in the right direction. But Scotland will be running on the dual fuel model of carbon and renewable energy for some time, and we need to have a sensible, collective, joined-up solution for transition. The workers involved need reskilled along that journey, and job opportunities and investments identified. Oil and gas companies and their workers are and must be part of that just transition. From COP26, paragraph 85 of the Glasgow Climate Pact has for the first time a reference to just transition. And how we do this is of great interest to others and other governments. In the recent report by PwC, Scotland scored 62 out of 100 in the Green Jobs Barometer, was the top-ranked part of the UK, and for every one green job created in Scotland, an additional 3 jobs are created elsewhere in the economy. But in a world where international investments can go anywhere, we need to anchor our transition with Scottish-owned, not just based companies, and we need to build in sustainability of the whole supply chain and procurement activity. And as we know from West Lothian transitions, inward investment is mobile and can leave. No government in the world has done enough to introduce the changes needed. But there is no country in the world quite like Scotland with our experience from shale to coal to cars to electric, hydro and nuclear to oil and gas to wind, wave and tidal, and now with a focus and drive to hydrogen. Yes, we will debate, question and scrutinise the steps on the way, but let us stand today united and committed to a just transition and to make it happen for our communities, our country and our climate.
Thank you. And I call Dean Lockhart to be followed by Katie Clark. Up to 4 minutes, please, Mr Lockhart.
Thank you very much, Presiding Officer. There is cross-party agreement in this Parliament about the need to transition to net zero in a fair and managed fashion. And I agree with many of the headline policies that the Scottish Government have announced to address the climate crisis, and I agree with a number of the remarks just made by Fiona Hislop. But I do have genuine concerns about how these headline policies are being implemented, the lack of resource, personnel and budgets being dedicated communicated, and frankly a genuine question about whether this government is more interested in headlines than delivering the real transformation required. And these exact same concerns were expressed today by the Independent UK Climate Change Committee in its progress report. It expressed real doubts as to whether Scotland would reach the 2030 interim targets because of what they highlighted as a concern over clarity and transparency on policy, that there is little detail to support the delivery of that policy, and implementation has been lacking. So let me help, in the spirit of cooperation, let me try to help the Minister here and provide some recent examples of what the Climate Change Committee is referring to in their concerns. In 2017, the First Minister announced the headline policy of a publicly owned energy company that would tackle fuel poverty, reduce energy prices and help meet climate targets. This remained a key Scottish Government policy for the best part of 4 years, with £500,000 of taxpayers' money spent on feasibility studies. But this policy was quietly airbrushed away during summer recess and replaced with the new headline policy of a national public energy agency, announced with the ambitious objectives of decarbonising homes and buildings and reducing fuel poverty. So far, so good. That sounds like a good policy. But again, on closer inspection, this turns out just to be a headline, with the Cabinet Secretary confirming to the Net Zero Committee that this virtual agency will be no more than a website with no additional resource, budget or staffing. In other words, a headline policy with no substance has been replaced with another headline policy with no substance. And that, Minister, is something that I have genuine concerns about. The policy intention, I think, is good, but the delivery is failing. And again, if we look at the Scottish Government motion today, we see the same approach being taken, proclaiming that this is the first government in the world to commit to a just transition planning framework. Yes, I'll give way.
Minister.
Can I thank the member for giving way? And he's referred to the Climate Change Committee's reports published this morning a number of times. And one of the references within that report is that if our carbon capture storage projects do not get the go-ahead in Scotland, we're going to have to up the commitments to other measures in Scotland, which the members have said are very, very challenging at the moment. Does it not therefore make sense for the UK Government just to give the go-ahead to the one project that's there, ready to go, the Acorn project, so we can get on with achieving our net zero targets and creating these good green jobs?
Dean Lockhart.
Yeah, thank you. Well, I'm glad to know that the Scottish cluster is in the first reserve list and continues to get significant support from the UK Government, including £31 million to date. And I'm pretty sure it has a healthy future backed by UK Government financing, which I believe it's not received any financing from the Scottish Government. But my question to the Minister, and perhaps he could address this, is in relation to the policy framework referred to in the Scottish Government motion today. What does it mean? How will it be financed? I don't see any targets or any meaningful way that this policy can be measured or delivered against. And on the subject, Presiding Officer, I'll wrap up soon, on the subject of retraining and creating new jobs, there's real concern over the Green Jobs Academy policy, how it will operate and the resources involved behind it. Again, the Net Zero Committee heard evidence that the Green Jobs Academy is just a website setting out a list of jobs, with the STUC telling the committee that it will not change any of the fundamentals of job creation or the skills required. And they go on to say that what is required instead is a far more fundamental policy change to deliver on jobs and a just transition. Presiding Officer, let me conclude again by quoting the Climate Change Committee today. Although it says a broad set of policies and proposals have been announced by the Scottish Government, there is little detail on exactly how emissions will be reduced in practice, and most concerningly, they go on to say that the credibility of the Scottish climate framework is in jeopardy. Thank you.
Thank you. I now call Katie Clark to be followed by Paul McLennan. Up to 4 minutes, please, Ms Clark.
Thank you, Presiding Officer. And I will use the short time available to me to outline some concerns about the failure to date to take the steps that we need to ensure that we are creating the green jobs that we need, despite ambitious targets. Because despite previous ambitious targets, jobs have not been created in the numbers and on the terms and conditions required to make a just transition possible. And unless we see seismic change, there will be no just transition. There's no doubt that we need a jobs and a workers-led transition with the trade unions at the heart of this debate in all sectors. However, as has been said previously, the latest figures from the ONS show that an estimated 21,400 direct full-time equivalent jobs were created in the low-carbon and renewable energy economy in 2019, the last year that we have figures, and that this was a fall from 23,100 the previous year and the lowest direct employment since 2014. The Scottish Government promised 130,000 green jobs by 2020, but the number of people directly employed in the low-carbon and renewable energy economy, as has been said, is 21,400, the lowest level since 2014. And my concern is that we really don't have a strategy presented today as to how we will create these new high-quality jobs. The Conservative Party amendment welcomes the UK Government's North Sea transition deal, which includes a commitment to work with employers to secure joint investment of £16 billion to retrain their workforces. But that deal fails to recognise the nature of the workforce, much of which are contractors, and therefore will not benefit from this deal. The recent debate on offshore training passports outlined the transferable skills that many oil and gas workers have. And the Robert Gordon University work found that over 90% of the UK's oil and gas workforce have medium top-level skills transferability and were placed to work in adjacent energy sectors. And that report projected that 100,000 in that sector are likely to be in jobs that have transferred from existing oil and gas to offshore renewable roles. But of course, that's only approximately half of the workforce that we're talking about. The announcement on Campbell makes clear that change is coming. Green, well-paid jobs, however, are not currently being created in the numbers required, and much more needs to be done by both governments to make them a reality. Of course, Scotland has huge potential to lead the way in renewable energy. But our history is one of innovation and invention, but of failing to turn that into mass production. And of course, that's what's happened in the renewable sector in recent decades. We need an industrial strategy which lays out how domestic industrial capacity will ensure the growth in renewable energy production and new jobs in Scotland. As a first step, we need to create a publicly owned energy company, but we also need to look at municipal energy production, such as the solar energy farms being created by North Ayrshire Council. The model of public energy provision is mainstream in many other parts of the world, including Germany and the USA. I welcome the debate on all sides, but I have to say that to deliver a just transition, we need to be more radical.
Thank you. I now call Paul McLennan to be followed by Mark Ruskell. Up to 4 minutes, please, Mr McLennan.
Deputy Presiding Officer, thank you. I welcome this opportunity to speak in this debate. A just transition is key as we move from fossil fuels over the next number of years. Yesterday, I, along with other SNP colleagues, met with Scottish Renewables, and we heard of the opportunities of the renewable sector in Scotland, delivering an additional 17,000 jobs with an additional £33 billion of GBA by 2030. We also heard from Lee MacArthur earlier on around about the opportunities around about 34,000 jobs in retrofitting. And as Tess White mentioned, and Katie Clark mentioned as well, there was also the recent report by Robert Gordon University stating that 90% of oil and gas industry jobs have medium to high transferability into green and net zero industries. And there lies the opportunities for us. On planning for a managed transition, we need this period of change to be shaped proactively. Now, it's been mentioned before around about the new Just Transmission Commission being recently announced, and it's led by Professor Jim Skia. And obviously, he has a Greek background. He's co-chair for the United Nations IPCC. And I think this is a really important point, and I think it's been brought up by a few people as well. The Commission will provide scrutiny and advice on the ongoing development of Scottish Government-led transition plans, and that's quite right. Every government should be held to account, including the application of the Just Transition Planning Framework. It will also advise the most suitable approaches to monitoring an evaluation. I look forward to debating that when it comes forward next year. The Commission will also undertake engagement with those most likely to be impacted by the transition, hearing from a broad range of represented voices. And again, I think Katie Clark mentioned it around about the unions. I think they are vitally important as we look at doing that going ahead. And as I said before, there will be crucially an annual report to reflect on the progress and of course held to account, and that was mentioned as in the CCC call for transparency this morning. Now, the initial Just Transition report was organised into 4 overarching themes: planning for a managed transition, equipping people with knowledge and skills, involving those who impacted through co-design and collaboration, and spreading the benefits of the transition widely. In my short time, I want to focus on 2. One is planning for a managed transition to net zero that maximises the economic and social opportunities while managing the risks. And secondly, that people in Scotland will be equipped with the knowledge and skills they need to engage with and benefit from the net zero transition, while putting in place safety nets so that no one is left behind. On managing the transition and maximising economic benefit, we need to continue to set just transition plans for high-emitting industrial sectors of the Scottish economy. We need to continue to set out clear milestones out to 2045, working with industry, unions and local communities to consult these on the best way to develop and implement these. The public sector must be more strategic in its use of funding streams to build strong and resilient local supply chains, ensuring maximum economic benefit. I'm already undertaking work with my local authority in this regard. ScotWind opportunities now and in the future must be utilised to secure new opportunities for the Scottish supply chain. The recent Scottish Offshore Wind Energy Council Strategic Investment Analysis report looked at the opportunities for Scottish companies in this developing market and benefit from a growing global market. On skills, in Scotland we need to ensure that we are equipped with the knowledge and skills to ensure we are in a position to engage with and benefit from the net zero transition, ensuring no one is left behind. A just transition will demand a steady adaptation of skills and workforce practices in a way that will protect jobs and meet employer demand, contributing to tackle inequality. The Climate Change Emergency Skills Action Plan, CSAP, published at the end of 2020, set out an overarching approach for managing the skills transition. The CSAP implementation plan outlines an ambitious, cohesive approach to green skills and green jobs. The initial Just Transition Commission recommended the creation of such a skills guarantee for workers in carbon-intensive sectors who may find demand for their skills decline or even disappear as the economy changes. Presiding Officer, to conclude, the renewables opportunities present great opportunity. We need to maximise the benefits for Scottish companies with a highly skilled workforce and strong supply chain. But we also need to ensure there is a safety net to support the transition of workers and ensure that their skills and experience built up over many years are retained within the Scottish economy. Thank you.
Thank you. I now call Mark Ruskell to be followed by Graeme Simpson. Up to 4 minutes, please, Mr Ruskell.
Thank you, Presiding Officer. Well, post-COP26, this is a critical time to be doubling down on the climate science while ramping up action on a just transition. And of course, the oil and gas corporations have, for decades, funded climate denial. So it's no wonder that recent polling shows that the majority of the public do not trust them to lead the just transition. But the oil and gas workers deserve our respect, our support and solidarity for the huge contribution they've made to our energy needs since the 1970s. They should be the ones leading the just transition. But for years, they've faced uncertainty in a boom and bust sector. And despite an eye-watering £13.6 billion of tax subsidy donated to the oil and gas sector by the UK government since the Paris Agreement was signed, there continue to be major job losses. Over 10,000 job losses in the oil and gas sector over the last year, in a sector which employs directly just over 30,000, with nearly three-quarters of workers now employed ad hoc as contractors. So it's no wonder that over 80% of oil and gas workers in a recent survey said they would consider moving to a different sector, with over half of those interested in renewables and offshore wind. And job security was cited as the biggest factor in that survey. But the UK policy of maximum economic recovery of oil and gas does not help with that just transition. It postpones action, it drags investment away from renewables, and it creates a future cliff edge for workers. And it also, of course, critically undermines the global UN climate negotiations, making it impossible to ask countries to adopt the language of phasing out coal when we won't phase out our own oil and gas. Now, this policy of maximum economic recovery could lead to a future sudden collapse in jobs where climate impacts lead to a high carbon price, shutting down production. And if we can learn anything from the Tories' brutal dismantling of the coal industry in the 1980s, it's that sudden collapses like this punish communities for generations. I don't think I've got time, unfortunately, but it is absurd to say that stopping Cambo would mean turning off the taps on North Sea oil and gas, leading to that kind of unmanaged collapse. Because there are already 6.5 billion barrels of oil in over 200 fields already licensed in the North Sea, enough to see us through years and years of energy transition. And it's clear that Cambo would be disastrous. The emissions from burning all 800 million barrels of oil in the field would be 10 times the annual emissions of Scotland, lasting well beyond 2045, when we're meant to be a net zero country. And where would the jobs go? Siccar Point Energy have said that the engineering construction work would be outsourced to a firm based in Singapore. The whole operation is designed to need just 100 to 150 staff, who could end up being drafted in from anywhere in the world. Now, calling a halt to Cambo and other new fields is the start of a managed transition, rather than a future based on the economic chaos of stranded assets that we cannot afford to burn. And there have been years of warnings from Mark Carney to the IEA of exactly this scenario. Presiding Officer, the announcement of the turbine tower factory at Nigg last week was a hugely important step. It needs to be the first of many more announcements that build a high-value supply chain in Scotland with quality, fair jobs. The just transition must follow the climate science, but it must also be designed by the women and men whose livelihoods depend on its success, rather than listening wholly to corporate boardrooms that have continually let workers and our climate down for many years.
Thank you. I now call Graham Simpson to be followed by Jackie Dunbar. Up to 4 minutes, please, Mr Simpson.
Thank you very much, Presiding Officer. We're having this debate against a backdrop of COP26 having just been held, and Patrick Harvey rejoicing in the potential loss of nearly 100,000 energy jobs in Scotland. The same Mr Harvey who insists on giving cyclists a bad name every time he gets on his bike, whether it be for a ministerial photo call or not. And it's transport that I want to focus my comments on, because it's our biggest emitter of greenhouse gases. We need to decarbonise aviation as much as possible, our ferries, which shouldn't involve buying second-hand diesel boats, our trains, buses, lorries and cars. There's a lot to do. We also need to get more people making those very small local journeys under their own steam where possible. So that's cycling, walking and wheeling. Now, the government motion refers to the Just Transition Commission report and the government's response to it. On transport, the response says the ambition is that public transport and active modes of travel are the norm, supplemented by zero-emissions vehicles where needed, which is all fine. The challenge is how to get there. If we want to get more people onto public transport, then the services have to be there for them to use, and they need to be at fares that are affordable. So cutting train services isn't the way, as Colin Smith noted, and having public transport deserts, as we do in some places, isn't the way. We need to move to a fully integrated system, and we're a long way from having that. Public transport is nowhere near being the norm. We've yet to see significant reform of the bus system. We don't yet know what the Scottish Government has planned for our railways, and we're months away from it being nationalised. And we know that the way the ferries are run is in dire need of a shake-up. We just need the government to accept that. Active travel also isn't the norm, but it is affordable for many and low carbon. And in order to encourage more people to take up cycling, we need safe cycling infrastructure, and that usually means segregated. I was at the COP26 rally in Glasgow. I cycled there in the rain, and the message from my fellow cyclists was that our machines fight climate change. Mark Ruskell was there as well. Investment in cycling is good value for money, and investment in cycling infrastructure and cycling projects creates new green jobs. Cycling can be part of a just transition to net zero, which also means tackling transport poverty. People in low-income households are far more likely than richer households to use public transport rather than owning a car. 60% of households with an income of less than £10,000 don't have access to a car. 55% of households in North East Glasgow have no access to a car. Using a bike is a much more affordable option for many on low incomes than e-vehicle ownership. 81% of people say they would be motivated to cycle if there were more cycle lanes, traffic-free routes and off-road cycle paths, because they currently feel unsafe on the roads. So I'm going to be looking very carefully at what's announced in the budget this week. We'll need action on electric vehicles, buses, trains, ferries and active travel, as well as on improving existing roads. They're all compatible and they must happen. So this week can be a key test of whether we're serious about change or if it's all hot air.
Thank you. And our last speaker in the open debate is Jackie Dunbar. Up to 4 minutes, please.
Thank you, Presiding Officer. I'm delighted to have the opportunity to speak on this motion today, an issue which is so important not just to me, but also my constituents in Aberdeen Donside and to the wider North East economy. It's no surprise that the North East has relied on the oil and gas industry for many years to provide vital jobs and investment in the region, and as a result, it has flourished. Everyone in my constituency is either involved in or knows someone in the industry, whether that be directly employed by an oil and gas firm or in the supply chain. A hard shutdown with no alternative jobs and investment is not an option. Similar to the closure of the mines in the 80s, an entire region would just collapse. We cannot go down that road. We must ensure that jobs are put in place to support the 100,000 people who work within the industry. And it must be done in a fair and just way that leaves no one behind, providing sustainable, well-paid jobs for years to come. The UK Government have already deserted the North East on carbon capture. The opportunities which came with the carbon capture, utilisation and storage within the Acorn project could have been transformational for the region. And while members opposite have highlighted that this is a site on the reserve list for funding if one of the other projects falls through, this provides little assurance for my constituents and the wider North East, who don't need empty promises and reserve status. They require solid opportunities and funding to achieve a just transition and net zero. Sorry, I don't have time today, thank you. There can be no just transition without taking the North East along with us, and at the moment we are being left behind by the UK Government. Presiding Officer, the transition away from oil and gas is required to meet our climate change targets. We have a responsibility to play our part in tackling the climate emergency. Inaction is simply not an option. Of that, I think we can all agree. I have focused mainly to this point on the job aspect of the need to transition, but climate change presents a massive opportunity to strive for high-quality, zero-carbon housing and tackling inequality. And social justice can also be at the heart of our just transition. In addition to funding the buildings of thousands of new homes, the Scottish Government is rightly increasing investment in home energy efficiency measures. The majority of buildings in Scotland are going to continue to be used in the future, so we have to retrofit what we have if we are serious about getting our buildings to net zero. On that note, I am pleased to see £1.8 billion is to be invested over this parliamentary session, allowing us to accelerate energy efficiency upgrades and renewable heating deployment, creating new jobs and supply chain opportunities across Scotland. Presiding Officer, this transition must be just and it must protect the jobs of those already in the industry. The Just Transition Commission will be key to ensure no one is left behind. The Commission will engage with those likely to be impacted by the transition and support and scrutinise the Scottish Government's plans for that transition. And I was pleased to see the Scottish Government commitment of £500 million over 10 years to support people's jobs and livelihoods in the North East and accelerate the plans for a just transition in the region. The Energy Transition Fund also provides £62 million to support our vital energy sector and promote sustainable, inclusive growth as we move towards net zero by 2045. Presiding Officer, I understand and sympathise with those in the North East of Scotland who may fear the transition and may not be able to imagine an Aberdeen without oil and gas. And I welcome the establishment of the Just Transition Commission, who will work to ensure that nobody is left behind. And this is a good first step to be working towards. We must continue to work together to achieve net zero. Thank you.
Thank you. I will now move to winding up speeches, and I would remind members that there is no time in hand and any interventions must be absorbed. I call on Mercedes Villalba to wind up for Labour. Up to 4 minutes, please.
Thank you, Deputy Presiding Officer. As we've heard this afternoon, the Scottish Government's response to the Just Transition Commission's report was not bold enough. In particular, there are 4 key areas which are crucial to delivering a just transition, and that's skills transferability, public transport, fair work and support for consumers with energy costs. On skills transferability, we heard from Katie Clark that the Scottish Government must do more, particularly in the offshore energy sector. Offshore oil and gas workers are being prevented from transitioning into greener jobs because of training costs and a lack of common training standards in the offshore energy sector. So I've been working with trade unions like the RMT and climate campaigners like Friends of the Earth Scotland to highlight the need for an offshore training passport. I haven't got time. When I first raised this issue back in September, the First Minister welcomed it as a constructive proposal. But the follow-up letter I received from the Just Transition Minister offered no new ideas. When I raised the issue again in October, the Minister for Green Skills said she'd be delighted to meet to discuss this issue, but that meeting has never materialised. So perhaps today's Minister can clarify the Scottish Government's position. The Energy Skills Alliance, the ESA, is currently developing an all-energy apprenticeship. And that will benefit new entrants to the industry, but it's not going to help the existing workforce. So I'd like to ask the Minister to address in his closing remarks whether the Scottish Government will commit to exploring all options for the introduction of an offshore training passport, including through the ESA. We heard from Graham Simpson that on public transport, the Scottish Government must do more. They say that they will commission a fares review to look at an integrated approach to transport fares. But many will be wondering why integrated fares could be delivered for COP26 delegates, but now it requires a review before it can be rolled out to ordinary passengers. The Scottish Government is also committed to introducing free bus travel for the under-22s, but this doesn't go far enough. Yesterday, my colleague Paul Sweeney launched his campaign to extend free bus travel to asylum seekers. It would use just 0.0005% of the Scottish budget. For such small change, it would make a huge difference. Another crucial omission from the Scottish Government's response is the key role that councils could play in providing affordable, accessible and sustainable public transport. Councils now have the power, but not the cash, to implement this. So I'd like to ask the Minister if he'll commit to looking at all options, including providing start-up capital through the Scottish National Investment Bank to empower councils to set up municipal bus services. On fair work, there are fundamental barriers such as low pay, insecure work and poor working conditions, which often prevent workers transitioning into green jobs. To ensure that our transition away from carbon-intensive sectors is worker-led, we must ensure that new green jobs are well paid on secure contracts with excellent terms and conditions. The Scottish Government has committed to introducing a new Just Transition Commission. This new commission must act in the interests of workers. So that leads me to my third ask of the Minister. Will he look at instructing the new commission to plan for a just transition framework which extends trade union recognition and collective bargaining rights for workers in all green sectors of the economy? And finally, on public energy. Yesterday, a poll for Citizens Advice Scotland revealed that more than 1 in 3 Scots are struggling to pay their energy bills. And last week, after 2 years of waiting, the Scottish Government finally released the outline business case for a publicly owned energy company, and that found that it would produce annual savings for consumers. But despite so many struggling with energy costs, the Scottish Government appears to be abandoning its pledge to deliver a publicly owned energy company, as raised by Dean Lockhart in the debate.
Ms Fiaba, could you please conclude? You're over your time.
So my final ask of the Minister is, will the Scottish Government fulfil this pledge, or is it going to be just another empty promise?
Thank you. I now call on Liam Kerr to wind up for the Conservatives. Up to 4 minutes, please, Mr Kerr.
Thank you, Presiding Officer. What is absolutely clear from the motion, the amendments and the contributions this afternoon is the importance of achieving, alongside our net zero ambitions, a just transition. Tess White put it well, saying a just transition is critical to safeguarding jobs in the energy sector, to protecting the UK's energy security and to a green recovery. Now, Liam MacArthur hit the nail on the head when he said there needs to be credibility. Presiding Officer, the government benches have little of it. Graham Simpson picked up the shameful comments of a government minister describing those who support a managed and fair transition for the oil and gas industry as the hard right. And members of the Green Party celebrating moves which risk up to 100,000 jobs while threatening to, quote, seize assets and prosecute executives. The usually sensible Mark Ruskell doubled down on these comments in some disappointingly ill-informed remarks, and it's that sort of tone which undermines government credibility in this area. And the SNP's, I'm short of 2 minutes, I'm afraid, Mr Ruskell, the SNP's credibility isn't enhanced when senior government ministers argue that the future of the planet depends on Scottish independence. Presiding Officer, several contributors raised the Climate Change Committee's report. It warns that credibility will be undermined if there's a widening of the gap between targets and achievement. Yet members will well recall John Swinney's boast in 2010 that offshore wind energy would create 28,000 posts by 2020. It has delivered fewer than 2,000. Colin Smith pointed out that there have been around 22,000 renewable energy jobs created in Scotland. Yet, in response to a parliamentary question last week, the Minister conceded that no data is available to provide geographic breakdowns below Scotland level. So the Scottish Government doesn't even bother to interrogate the data to find out whether job creation is happening in areas such as the North East, where job losses are greatest. And credibility is further damaged by Jackie Dunbar's reference to a Just Transition Fund and calls for the UK Government to match it. I remind her that the Minister's copy and paste responses to my parliamentary questions show there are no details about when, where, to whom, from whom or for what it will be paid. We don't even know which budget it's coming from, and there won't be until spring 2022. What a contrast to the UK's £16 billion North Sea transition deal, that matches the Just Transition Fund 32 times over, which will deliver 40,000 jobs and is happening now. Presiding Officer, we've heard that achieving a just transition requires that we take a rational approach to this debate and do not demonise particular industries and companies. My North East Conservative colleagues and I met with BP last Friday to discuss efforts they're making to utilise their skills, leadership and workforce to effect a genuinely fair and managed transition. Most oil and gas companies in the UK are doing similar. And then ask, who is going to finance the bulk of the $70 to $100 trillion costs of global transition? Well, it will have to be private sources, sovereign wealth, pension and hedge funds, asset management companies, investment trusts and energy companies. Now, I know some members don't like to hear that, but we have to start talking sensibly, scientifically and rationally about the industries we are transitioning from and to and how. Now, Dean Lockhart pointed out that the Scottish Government specialises in headline policies with no substance. And yesterday, Russell Borthwick at the Aberdeen and Grampian Chamber of Commerce said, we need Just Transition to become a meaningful programme of action, not just a glib phrase. They're both right. So I say to the Minister, we will vote for his motion's warm words, but he must move away from the soundbites and the virtue signalling, acknowledge our demand for meaningful action and vote for our amendment today. Thank you.
Thank you. And I now call on Minister Richard Lockhead to wind up for the Scottish Government. Up to 6 minutes, please, Minister.
Thank you, Deputy Presiding Officer. I think it's pretty clear that from today's debate, which is an important debate, and I'm sure we'll have many more debates like this in the coming years, It's clear that we all approach this agenda from different perspectives and viewpoints, but there is broad consensus and urgent need to tackle climate change and to do so in a way which is fair and brings households, businesses and communities with us. And I know that many across this chamber have that shared ambition, and there is opportunity, hopefully, for us to work together to ensure that we get this right in the coming years. Whilst there will always be disagreements over policies and priorities, I believe there is a lot of consensus on the importance of delivering a just transition. But that won't stop me picking up on some of the inherent contradictions, particularly from the Scottish Conservative Party's benches. On the one hand, we are hearing from Tess White and others there should be unlimited extraction of fossil fuels. But on the other hand, they're complaining the Scottish Government's transition is not going fast enough. That doesn't make sense and it doesn't square. And the situation is that, I think Graham Simpson actually said he took part in the rally. He took part in the rally and the protest at COP26 because clearly you thought there's an urgent need for action to save the planet. Yet you're willing to talk the talk, but when it comes to walk the walk and the cold reality of taking difficult decisions, you're full of double standards and hypocrisy.
Graham Simpson.
I can tell the Minister, I've got no double standards in me. I've been fighting for cycling for years, and that's why I went to that rally, and that's why I stood beside fellow cyclists who are saying that cycling can save the planet. That's not double standards.
Minister. Another issue over the hypocrisy from the Scottish Conservatives today is the non-stop complaining about the lack of action to create green jobs as alternative employment opportunities for those working in carbon-intensive industries. Yet this is the party and this is the UK Government who just rejected the Acorn project, the best project for carbon storage in the whole of the UK, that would have created 15,000 green jobs, mainly in the north east of Scotland.
Liam Kerr, briefly, Mr.
Kerr. The UK Government's put in £31 million so far to that project. How much has this Minister's Government put in?
Minister.
15,000 green jobs, that's what you've turned down at the same time as you're complaining to the Scottish Government for not creating enough green jobs for your constituents in North East Scotland. So I'm afraid that is more hypocrisy, that is more double standards from the Conservative Party's benches. There were many references to the Climate Change Committee's report that was out today, which of course poses a number of challenges to the Scottish Government that we have to take seriously, because no one has all the answers at this point in time to many of the questions and the changes we have to implement in society and how that will be done in the fairest possible way and where all the solutions will come from. But, Chris Stark, the Chief Executive of the Climate Change Committee, said this morning there are some really positive aspects of the Scottish plans. The focus on a just transition and the clear steps to integrate net zero into ministerial portfolios across the Scottish Government are great, and it's also good to see ambition raised in other areas, such as agriculture. I'll take one more if I'm permitted.
Yeah. Mr. Whittle.
Appreciate you taking another intervention. You'll also know that Chris Stark said, as I said earlier on, there's no direct policy transparency that shows how the Scottish Government will reach these targets that it's set.
Minister.
That's exactly the same as the intervention made earlier on in the debate, which I answered at the time. But at COP26, and this is the difference between what we're hearing from some of the members of this Parliament today and what we hear from the rest of the world, is the rest of the world are looking at Scotland and the leadership we're actually showing when it comes to implementing the just transition. And it's the leadership that Scotland is showing that is leading to many green jobs being created in our country at the moment. The Labour Party lament the lack of action over green jobs, and I said that the latest tranche of awards from the Green Jobs Fund today is creating over 800 green jobs in Scotland. But the private sector is creating tens of thousands of green jobs that are being pledged due to leadership the Scottish Government and indeed Scotland is showing in terms of going towards our net zero target. Many people refer to Global Energy Group's proposals for NIG, which will create 400 long-term direct jobs and over 1,000 indirect jobs. We've got the heat pump manufacturing jobs and heating and building jobs. 16,400 jobs will be created, green jobs by 2030. The hydrogen policy statement says up to 300,000 green jobs could be supported by 2045. And of course, Robert Gordon University said that there's potential for up to 300,000 jobs in offshore in Scotland and throughout the UK as well. And of course, the Acorn project, which has been rejected by the the Conservative UK Government would have created 15,000 green jobs as well. Not in 10 years, not in 20 years, but from next year onwards, 15,000 green jobs. Let that sink in. Remember, there are 70,000 oil and gas jobs in Scotland, so that 15,000 jobs is over 20% alone of what we have in the whole of the oil and gas sector in Scotland, yet the Conservative Party turned down that opportunity. So, just in closing, Presiding Officer, I just want to say the Just Transition is about learning from past mistakes. We're going to stand by jobs in Scotland that are working in carbon-intensive sectors just now, work with them, make sure workers and citizens have a voice in their own future and in Scotland's future. We're going to use the challenge of climate change as a window of opportunity to tackle embedded inequalities in our society, as well as create those green jobs, but not just green jobs, but good green jobs as well. So this government, this parliament, this country can make a contribution to tackling global warming, but at the same time improve the quality of life of people who live in their own country. Thank you.
Thank you. That concludes the debate on delivering a just transition to net zero and climate resilience for Scotland. It is now time to move on to the next item of business, which is consideration of a legislative consent motion. And I ask Jamie Hepburn to move motion number 2430 on Advanced Research and Invention Agency Bill UK legislation.
Move, Presiding Officer.
Thank you. The question on this motion will be put at decision time. The next item of business is consideration of business motion 2457 in the name of George Adam on behalf of the Parliamentary Bureau setting out changes to business this week. I call on George Adam to move the motion.
Thank you, Presiding Officer. And moved.
Thank you. And I call on Neil Bibby to speak to and move amendment 2457.1. Up to 5 minutes, Mr Bibby.
Presiding Officer, I move the amendment to the business motion in my name, which will extend business by 30 minutes on Thursday, with decision time being at 5:30 p.m. There is no parliamentary event more important than the budget, and there is no year that the budget has been more important than this year. The people of Scotland who we represent need this budget to be a budget for real recovery, a budget which sets Scotland on a path for a brighter and better 2022, and to help make the lives of the people we represent better. I sincerely hope it can do so, and we in the Scottish Labour Party are determined to play our part in scrutinising government and asking questions on behalf of our communities. The government is perfectly entitled to bring forward a ministerial statement on supporting culture in Scotland on Thursday. I don't know what will be in that statement, but I do know it is not one of the statements that the number of statements the opposition has requested. But one thing is clear: we must also have additional time in Parliament for more questions on the budget too. Currently, the Labour Party is only permitted to have 5 questions to scrutinise this budget. Presiding Officer, the governing parties, the SNP and Greens, will combined have 15. That may be good enough for them, but we have many more than 5 questions to ask on behalf of our constituents on jobs, hospitals, schools, buses, housing, the environment, our high streets and many, many more issues. If the Scottish Government do not agree, then it begs the question, what do they have to fear from scrutiny? This budget needs to be a budget for real recovery and a budget for jobs. Presiding Officer, we need to do our job, and if it means staying an extra half an hour on Thursday to do it, then so be it. Scottish Labour, therefore, is calling on Parliament to back our amendment. We do so in the hope that this budget truly can be made to kickstart recovery and to make a difference for the people of Scotland. I move the amendment.
Thank you, Mr Bibby. I call on Stephen Kerr.
Presiding Officer, I rise to speak against this business programme motion and in support of the amendment. Presiding Officer, as you know, I've been in touch with Bureau members over the past few weeks regarding the budget statement on Thursday. Initially, the Government planned for the budget statement to last 1 hour, 20 minutes for the statement itself and only 40 minutes for questions. And while it's true that the statement was extended from 60 minutes to 90 minutes, realistically, this merely brought it in line with the last few years' budget statements and was therefore not an extension or indeed any kind of a compromise at all. There is now, as we have heard, to be a statement on culture on Thursday, and I am sure, as he did at Bureau, Mr Adam, the Minister for Parliamentary Business, is about to take umbrage and pretend that my objection is an insult to culture. Such nonsense, indeed drivel. The real insult to culture, Presiding Officer, is that it is being used in such a shoddy way to be shoehorned in when it was suggested that the time in hand after the budget could be used to provide more MSPs with the opportunity to ask a question. The inescapable conclusion from all the programming shenanigans is that the prime reason for this statement being added in at the last minute is to protect Ms Forbes from answering questions. I certainly have confidence that the Cabinet Secretary would be up. I certainly have confidence that the Cabinet Secretary would be up to answering backbench questions. Why doesn't he? Mr Adam refused my reasonable suggestion in Bureau to move the culture statement to next Tuesday, where it would not be overshadowed by the budget. This stands in stark contrast to his failure to allocate time for a statement on the circular economy during COP26, because at the time he maintained it would be overshadowed by the international event. Presiding Officer, where is that concern now? This is about protecting ministers from the scrutiny of this Scottish Parliament. What this shows more than anything else is a culture of contempt in this government for the openness and oversight that the Scottish Parliament brings. It seems that they have no appetite for accountability. They'd rather deflect and obscure what is going on in the public finances and in any other area of public policy. More time for more questions and discussion on the budget is needed. How can it ever be a bad thing, Presiding Officer, in the Scottish Parliament to ask questions of the Executive? And I conclude, there is a growing danger that the more the Scottish Government tramples over the Scottish Parliament's business schedule, the more accustomed to it we all become. Backbenchers deserve to have their questions answered. The desires and concerns of our constituents deserve to be heard in this chamber.
Mr Kerr, can we please hear Mr Kerr, colleagues? Thank you.
Thank you, Presiding Officer. It is the job of the Scottish Parliament to hold the Scottish Government to account. The people of Scotland deserve no less. And therefore I urge members to reject the programme motion in favour of the amended motion.
Thank you, Mr Kerr. I call on George Adam to respond on behalf of the Parliamentary Bureau. Up to 5 minutes, Minister.
Thank you, Presiding Officer. Can I just state at the very beginning, Presiding Officer, that I've known Kate Forbes for many years, and Kate Forbes does not need me to hide behind in any shape or form. But the important point of what we're discussing here is, you know, I sometimes wonder, Presiding Officer, was this big daft boy Fifigi seems to be the one that's controlling the whole Scottish Parliament, according to Mr Kerr, as opposed to ourselves working together in the Bureau to create the business of Parliament. But just to actually, after having the pantomime that we've just recently had, Presiding Officer, I think it's time to talk about the actual facts. The statement on the Scottish Government the budget coming this Thursday is scheduled for 95 minutes. That's 95 minutes, allowing for 65 minutes of questioning. Now, it's not my fault. I can't do anything about the Conservatives' questions and the fact they can't ask questions that maybe give Ms Forbes any difficulty, but that's not my problem. But at the end of the day, this is an increase. This is an increase, Presiding Officer, on the average of 58 minutes in the last 4 years, which Stephen Kerr pointed out to me in an email last week. This 95-minute statement is in addition to Stage 1 debate due to take place in the end of January, a Stage 2 debate at committee at the beginning of February and a Stage 3 debate in mid-February. I can assure members that the adequate time will be given to the budget, that there will be no limiting of scrutiny being proposed by anyone here at all. Thursday's proposed business includes a statement in supporting culture in Scotland, because culture is a key economic sector. In 2019, the creative industries contributed around £4.5 billion to the economy, employed over 127,000 people. Now, I heard earlier on today at Bureau, and it was hinted at here today, that this was some kind of buffering, using culture to use up parliamentary time. That, Presiding Officer, is an absolute disgrace, because this is an industry that is extremely important to Scotland, it's extremely important to our economy, and after the year that we have had, after the 18 months to 20 months that we've had, I think it's important that we actually discuss what's happening in culture now and what we're doing for the future. The pandemic The pandemic hit the culture sector harder than almost any other, and it continues to face challenging conditions. We continue to hear that businesses are still fighting for survival, and it is essential that we allow parliamentary time to consider how we best support this vital sector in Scotland. It's down to this Parliament, Presiding Officer, to discuss the business that involves the people of Scotland, not some flight of fantasy of the Conservative Party.
Thank you. The question is that Amendment 2457.1 be agreed. Are we all agreed? Yes. The Parliament is not agreed, therefore we will move to a vote and there will be a short suspension to allow members to access the digital voting system. Amendment 2457.1 in the name of Neil Bibby, which seeks to amend Motion 2457 in the name of George Adam on setting out a business programme, be agreed, and members should cast their votes now. The vote is now closed. The result of the vote on Amendment 2457.1 in the name of Neil Bibby is yes 52, no 67. There were no abstentions. The amendment is therefore not agreed. The next question is that motion 2457 in the name of George Adam on setting out a business programme be agreed. Are we all agreed? Yes. Parliament is not agreed, therefore we will move to a vote and members should cast their votes now. The vote is now closed. Point of order, Claire Baker.
Correct. I wish to vote no.
Thank you, Ms Baker. We'll ensure that's recorded. Point of order, Craig Hoy.
Device seems to have frozen, but I would have voted no.
Thank you, Mr Hoy. We'll ensure that's recorded. The result of the vote on motion 2457 in the name of George Adam is yes 67, no 52. There were no abstentions. The motion is therefore agreed. There are 4 questions to be put as a result of today's business, and the first is that Amendment 2429.1 in the name of Tess White, which seeks to amend motion 2429 in the name of Richard Lockhead on delivering a just transition to net zero and climate resilience for Scotland be agreed. Are we all agreed? Yes. The Parliament is not agreed, therefore we will move to a vote and members should cast their votes now. The vote is now closed. The result of the vote on amendment number 2429.1 in the name of Tess White is yes 31, no 68. There were 20 abstentions. The amendment is therefore not agreed. The next question is that amendment 2429.2 in the name of Colin Smith, which seeks to amend motion 2429 in the name of Richard Lockhead on delivering a just transition to net zero and climate resilience for Scotland, be agreed. Are we all agreed? No. The Parliament is not agreed, therefore we will move to a vote and members should cast their votes now. The vote is now closed. The result of the vote on amendment number 2429.2 in the name of Colin Smith is yes 24, no 94. There were no abstentions. The amendment is therefore not agreed. The next question is that motion 2429 in the name of Richard Lockhead on delivering a just transition to net zero and climate resilience for Scotland be agreed. Are we all agreed? Yes. The Parliament is not agreed, therefore we will move to a vote and members should cast their votes now. The vote is now closed. The result of the vote on motion 2429 in the name of Richard Lockhead is yes 96, no 22. There were no abstentions. The motion is therefore agreed. And the final question is that motion 2430 in the name of Shirley Ann Somerville on Advanced Research and Invention Agency Bill UK legislation be agreed. Are we all agreed? Yes. The motion is therefore agreed. And that concludes decision time. We'll now move on to members' business, and I would ask members who are leaving the chamber to do so quietly.
What distinguishes Broadcasting Scotland from a website or blog, apart from our brilliant programmes?
Hi there, I'm Gordon Ross.
Are the costs we face to enable us to produce those programmes. These costs are significant and ongoing. However, our facilities are able to do so much more if only we had the staff. In the last year, some of our supporters have cancelled their subscriptions. In one way, we would prefer it if it was because they didn't like us, rather than it being because of the financial pressures which we are all under because of COVID. The really positive outcome of our fundraiser is that at a time of economic challenge in Scotland, we will use your donations to create jobs and in a small way contribute to improving the Scottish economy. If you want us to be Scotland's independent broadcaster, able to provide an alternative mainstream television platform, then please support us.
Scotland is going to be an independent country.
Just imagine what we could do if we had even 1% of the BBC Scotland channel's budget. Imagine. And then please consider turning your imagination into reality. Please support us if you can afford it.